What's up, world? How are y'all? How are y'all? How are y'all? Today is Friday. You already know the deal. You already know what we're doing today. We're doing NCLEX questions. Sorry that I missed you guys on Wednesday, but your boy was tired and your boy had stuff to do. So, you know. So what we're gonna do is gonna wait for people to kind of show up here, and then once people get showed up here, well, hey, we will get it started. We will get it on and popping. We'll get it on and popping. Hey, so shout out to everybody that's jumping in. We're doing NCLEX style questions. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. We're going to be starting doing the NCLEX questions once we get a good amount of people up in here. So make sure you guys like, share, follow. Hey, I need the likes. I need the shares. Bro, we hit 10,000 people. 10,000 y'all like me. I don't know why. It could just be my, my banter. It could be the fact that I look like Jason Derulo. You know what I'm saying? Is that Ileana? Hello. Hello. How are you? So I'm a pediatric from Conroe. Conroe, man, where is that? Hey, where's that by? Is it Liliana or Ileana? I think it's Liliana. I think if it's Liliana, put two. Ileana, put one. So hey, make sure you guys share this, follow, and smash that like button, because the more that you smash the like button and the more that you share, got you, Liliana. Okay. The more that you smash the like button and the more that you share, the more people that can see this, and the more the algorithm will kind of like me. It's kind of liked me for the last like 2 days. So, oh my goodness. So Houston, okay, near Houston, yeah, that makes sense. That makes sense. I specifically live in San Antonio. I kind of like this place. I've been living here for a while, so I don't ever have any plans to leave unless I go to like Europe and kind of hang out there for a little bit. So shout out to all 90 of y'all that are in here. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. Are you a pre-nursing student? Are you about to start nursing school like in next semester? Are you in the middle of your semester? Are you about to take NCLEX? Let us know. Let us know. A little bit about me. Been a nurse for 3.5 years. I had ICU experience and also worked in the OR and did some PACU. Right now, I'm not really necessarily doing anything in regards to that. But kind of just hanging out, chilling. About to start my master's program in education, so you guys already know how that is. I love being here talking to you. I want to go to the Riverwalk. Ma'am, we don't go to the Riverwalk. We don't do that. We don't do that. But, I mean, it's cool. So you're in your last semester, graduate December 15th. Shout out to you, Miss User 80. Okay. Shout out to all 19 of y'all. All right, cool. Hey, the more folks we get up in here, the better. User 57, hello. How are you? We got 21 folks up in here. All right. All right. Hey, like I said, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. We hit 10,000 followers. I don't understand how 10,000 people like me, but I appreciate you. I'm so frustrated. I don't know specialty of nursing I want to go into. Hey, Anna, if you don't know what specialty of nursing you want to go to, the default is med-surg. Not shitting on med-surg, but you can really go to med-surg to figure out, like what's best for you or what would be a good area for you. At least you'll still be able to get the time management. You'll be able to get the skills of performing, nursing from, medical administration to, your health assessment, so on and so forth. Linko says, I'm in my 3rd semester after being an LPN for 20 years. Shout out to you, ma'am. Soon to be an RN. We speak it into existence. I hear horror stories about med-surg. It all just depends on where you are. I could give you a horror story about the ICU that I was in. I would not recommend anybody going to it. But, every ICU is different. So just like every other med-surg, right? Biggest thing is, are you being trained right? Do you have a good preceptor? Are you when you voice your concerns, do they hear you? And just about being receptive, like constructive criticism, not letting them try to treat you like trash and all that other good stuff. Yo, we got 111 people up here. Hey, shout out to y'all. Appreciate everybody being here. My name's Kevin. I go by the Boot Nurse on all those social media platforms. Make sure you guys check them out. We're about to do NCLEX questions. So we got 100 people up in here. So I want to know who you are, where you're from, and where you're at in your nursing journey. But without further ado, make sure y'all smash that like button, y'all share, and y'all follow. I'm about to turn this camera around so y'all can stop looking at me so we can do these questions. All right, cool. Hey, so welcome. We're doing NCLEX questions. Make sure you guys participate. I'm kind of funny. We'll see if I'm funny today. I guess it all just depends on y'all. The more likes, the more likes and everything, the more questions that you guys get. Today is Friday, so I plan on hanging out with y'all all night. Well, I don't know about all night, but for a little bit. Give me all them likes. Don't troll my chat, because if you troll my chat, I'm going to troll you, and I'm going to give you a 600. 600 pretty much is a ban. I'm telling you, you can ask other people. You come up here, play a game with me. I'm going to play a game with you, and I'm going to ban that ass. So just let y'all know what's up. I don't gatekeep. I got these questions off nurselabs.com. Take for that for what you will. It's still some type of something that can help you, okay? On Sunday at 1 p.m. Eastern Standard Time, so 12 p.m. Central Standard Time, I will be doing a nursing school summit presented by True Learn and Picmonic. I'm going to be specifically going over the new generation NCLEX, all the ins and outs, and, try to help ease your mind and thought process about going into that exam. Okay, so link is in my bio. It's in my link tree. In my bio, it's the first thing up top. Make sure you guys go over there and register. It's free. So, hey, go over there and get that knowledge. Just stop playing these games. All right, 7-day NCLEX course. It's my course. It's my baby. I created it because I never want anybody to feel how I felt. Hey, if you guys don't know, I failed my NCLEX 3 times. 3, not 6, but 3. All right, and you can still be very, very successful, and nobody will ever give a shit about how many times you've taken that exam. I promise you. Okay, you can still be. I know great nurses that have passed the first time. I know I meet great nurses who have passed first and multiple times, and vice versa. Okay, so and also check out thebootnurse.com. I'm kind of cool over there too. So without further ado, let us jump into the first question. All right. Hey, participate. I want to see all these answers. A patient in the cardiac unit is concerned about the risk factors associated with atherosclerosis. Which of the following are hereditary risk factors for developing atherosclerosis? Is it family history of heart disease? Is it overweight? Is it smoking? Is it age? We got A. Bree and T say I failed my NCLEX today, but I'm not giving up. That's what I'm talking about. Hey, so you failed that NCLEX, right? That's okay. If that's the worst thing that can happen to you, that's okay. You want to know something that's crazy? Is that whatever job you apply for, there's always a nursing job out here. I promise you. But you got this, and that's what this is for. All right, I'm gonna give y'all about 10 more seconds so we can answer this question. I usually have a stopwatch, but apparently the boy ain't got one. All right, we got A, we got some B's out here. What else we got? All right, looks like everybody's answering. Okay, all right, hereditary. Only one is A. Okay, all right, A's. D says A. All right, here we go. Here's our answer in 3, 2. And the answer is A, family history of heart disease. A family history of heart disease is inherited risk factor that is not subject to a lifestyle change. Having a first-degree relative with heart disease has been shown to significantly increase the risk. All right, it's just like with women who have first-degree relatives that have breast cancer. So the chances of that next person in their life getting that next person in the line getting breast cancer is pretty high. Okay, so remember, also this is one of the sections of the NCLEX PI, health promotion and maintenance, as well as when you read, make sure you read the question, make sure you read the rationale so you understand why the question is right. And then also read these answers so you know why they're wrong. All right, next one. All right, question number 2. Claudication is a well-known effect of peripheral vascular disease. Which of the following facts about claudication is correct? Select all that apply. Okay. It results when oxygen demand is greater than oxygen supply. It is characterized by pain that occurs or that often occurs during rest. It is a result of tissue hypoxia. It is characterized by cramping and weakness. It always affects the upper extremities. All right. So remember, this is a select all that apply. Okay. So I want to see all of them answers. Something that's new on the NCLEX is, it has partial credit for select all that applies and for certain questions that are inside of case studies. So, all right, what we got? We got D, Harry. I need more than one answer. All right, more than one answer. All right, I'm gonna give you guys about another 20 seconds. Another 20 seconds. Okay, A, C, D, A, B, C, D. Okay, Rachel, gotcha. B, C, D. Okay. What else we got? All right. Shout out to Jason. Jason, I see you out there. All right. Hey, make sure you guys keep smashing that like button. You guys are sharing. All right. Hey, here we go. In 3, 2. And the answer is A, C, and D. Claudication describes the pain experienced by a patient with a peripheral vascular disease when oxygen demand in the leg muscles exceed the oxygen supply. The tissue becomes hypoxic, causing cramping, weakness, and discomfort. And this is part of physiological adaptation, which is the third largest section on the NCLEX. Okay, number one is management of care. Number two, pharmacology. Number three, physiological adaptation. All right. Yeah. Okay. All right. Cool. Say ACE. There you go. ACD. ACD. All right. All right. Here we go. Here we go. On to the next one. All right. Here we go. Question number 3. A nurse is providing discharge information to a patient with peripheral vascular disease. Which of the following information should be included in the instruction? Walk barefoot whenever possible. Use a heating pad to keep feet warm. Avoid crossing the legs. Or use antibacterial ointment to treat skin lesions at risk of infection. All right, we got C's, we got C's, okay, C's, okay, all right, C's, all right. Shout out to all 110 of y'all. Appreciate y'all rocking with me today on this Friday. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. Let us know. You just now starting school? You already in school? You graduate coming up? Taking the NCLEX already? Hey, I heard somebody else that was unsuccessful, and that's okay. I'm going to give y'all 10 more seconds. Yo, sir, I just passed my NCLEX. Hope you remember me. Shout out to you, sir. Shout out to you. Everybody give, is it Cordero? G. Cordero. Hey, everybody give him his flowers. Let him know. Hey, show him some love. He passed that NCLEX today. Congratulations, sir. Welcome to the shit show. Welcome. Graduation coming up in December. All right, cool. Here's our answer. And the answer is C, of course. Avoid crossing the leg. Patient with peripheral vascular disease should avoid crossing the leg because it can impede blood flow. PVD, also known as arteriosclerosis, obliterin? Look, I'm not a spelling bee champion, let me tell you, okay? Is primarily the result of arteriosclerosis. The arteromo consists of a core of cholesterol joined to a protein with a fibrous intravascular covering. The arteriosclerotic process may gradually progress to, oh my God, I'm like hooked on phonics today, y'all, to complete occlusion of minimum size and large arteries. The disease typically is segmental, with significant variations from patient to patient. So it all just depends on the patient. However, on a general consensus, we don't want nobody crossing their legs. They're already having issues with circulation anyway. Okay. All right, here we go. Here we go. On to the next one. All right, here we go. Question number 4. A patient who has been diagnosed with a vasospastic disorder, Raynaud's disease, complains of cold and stiffness in the fingers. Which of the following descriptions is most likely to fit the patient? Is it an an adolescent male, an elderly woman, a young woman, or an elderly male? Kayla says B. Okay. Somebody says C. Father says B. Is that Rosie? Says C. Okay. Appreciate all the love. Appreciate all the follows. Make sure you guys like, share, follow. Hey, I got 10,000 likes. I got 10,000 followers, y'all. So I'm going to try to figure out how I'm going to stream this from a computer. All right, let me give y'all 10 more seconds. 10 more seconds. Thank you, Emily, for the follow. Appreciate you. Jason says B. Jason, you better get it right. Elderly woman. Who is that? She's a masterpiece. Ma'am, hello. How are you? Rob says B. All right. All right, okay. All right, here we go. Answer in 3, 2. And the answer is C, a young woman. Raynaud's disease is most common in young women and is frequently associated with rheumatologic disorders such as lupus and rheumatoid arthritis. Vasospasm of arteries reduce blood flow to the fingers and toes. In people with Raynaud's, the disorder usually affects the fingers. In about 40% of people who have Raynaud's, it affects the toes. Rarely the disorder affects the nose, ears, nipples, and lips. All right. If I get over 40, what? If you get it over 40, it is most likely to be secondary to another autoimmune disease. That is correct. Shout out to all 200 of y'all that are in here rocking with me. Make sure you guys like, share, follow. We're going to go on to the next question. Hey, health promotions and maintenance. That's the section, the client needs section on NCLEX that this question would fall under, okay? Here we go. 3. Question number 5. A 23-year-old patient in the 27th week of pregnancy has been hospitalized on complete bed rest for 6 days. Remember, so paint this picture, right? She's in the 27th week, 23 years old, bed rest, high-risk pregnancy of some sort, right? She experiences shortness of breath accompanied by chest pain. Which of the following conditions is the most likely cause of her symptoms? Is it a myocardial infarction due to a history of atherosclerosis? Is it a pulmonary embolism due to a deep vein thrombosis, anxiety attack due to worries about her baby's health, or congestive heart failure due to fluid overload? We got B, okay. Rachel says B, okay. B, easy. Okay, big money. Is that Blevin? Blevin says easy. Okay. I'm sorry, not, I'm gonna call, who is that? Blevin. I'm gonna call Blevin Big Money Blevin now. Since you like easy. Got it. I got you. Jason says B. All right, Jason, you better get these right. Is that Jelaine? I appreciate the follow. I'm gonna give y'all 10 more seconds. DVT due to stasis of blood flow. Okay, Father, I see you. User 83 says B. All right, cool. All right. Here's our answer. In 3, 2, and the answer, of course, is B. Pulmonary embolism due to deep vein thrombosis. In a hospitalized patient on prolonged bed rest, the most likely cause of sudden onset shortness of breath and chest pain is pulmonary embolism. Pregnancy and prolonged inactivity both increase the risk of clot formation in the deep veins of the legs. These clots can then break loose and travel to the lungs. I'm trying to tell y'all, if y'all have never seen a patient do what we call throw a PE, it's probably one of the scariest things you'll ever see, and you'll never forget it. You will never ever forget the sight of somebody who has a pulmonary embolism. It's terrifying. They'll get as white as the background of this PowerPoint. All right. So here we go. On to the next one. Hey, so every 5 questions we take a break. I'm gonna do this super quick. Hey, we're doing NCLEX questions. I love y'all's participation. Make sure you guys keep participating. Give me all them likes. Don't troll my chat. You troll my chat, I'm gonna give you a 600. That just means I'm gonna ban that ass if you act a fool up in my chat. I don't gatekeep. I got these questions off nurselabs.com. Also, I will be doing a nursing school summit presented by True Learn and Picmonic. That link is in my bio. Make sure you guys go over there, like, share, follow. 7-day NCLEX course, $48 right now. It's yours forever. It's updating every day. So make sure you guys go over there and check that out. Also, go check out thebootnurse.com. I'm kind of cool over there. Kinda. All right, here we go. On to the next one. All right. Question number 6. Thrombolytic therapy is frequently used in the treatment of suspected stroke. Which of the following is a significant complication associated with thrombolytic therapy? Is it air embolism, cerebral hemorrhage, expansion of the clot, resolution of the clot? Take my NCLEX in 2 weeks. All right, Maria, I see you. You're going to do all right. I've literally kicked people off of my live if they tell me, hey, I'm taking my NCLEX tomorrow. I literally kicked them out. I'm like, you ain't got no reason to be here. You take yours Monday. Hey, so is it Nini? Hey, on Sunday, don't you open up no book. Don't you do nothing. You better try to relax as much as possible on Sunday. Because if you don't know it by then or by now, you don't know it at all. And that's not being an asshole. That's just being real. 10 more seconds. It's all about the tough love, but I understand. All right. Here we go. Here's our answer in 3, 2, and the answer is C, cerebral hemorrhage. Cerebral hemorrhage is a significant risk when treating a stroke victim with thrombolytic therapy intended to dissolve a suspected clot. The success of the treatment demands that it be instituted as soon as possible, often before the cause of stroke can be determined. Definitely. I got you. All right, cool. Appreciate all the follows. Stephanie, is it Robertson, user 229? Appreciate the follows. All right. Hey, physiological adaptation, 3rd largest section on NCLEX. Just so you guys are aware. Hey, no, there's 8 sections of the NCLEX, all right? 8. All right, here's question number 7. An infant is brought to the clinic by his mother, who has noticed that he holds his head in an unusual position and always faces to one side. Which of the following is the most likely explanation? Remember, if I could tell my patient one thing that would be the most accurate, what would it be? Would it be torticollis, with shortening of the, what is it, the sternocleidomastoid muscle? Is it a craniostenosis? Yeah, craniostenosis with premature closure of the cranial sutures. Is it plagiocephaly with flattening of one side of the head, or is it hydrocephalus with increased head size? We got A. We got A's. What else everybody got down here? Bianca says A. Everybody says A. Man, y'all smart. Y'all so smart. I appreciate y'all. Hey, make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys keep smashing that like button. Make sure you guys share, like, and follow. 10 more seconds. 10 more seconds. Hey, and there's another thing too. You guys can answer each other's questions down there. All right. You guys can converse with one another. Is it Ireland? Appreciate the follow. I thought it was C. I ain't even set the answer yet. Erica says A. All right. All right. Here we go. Here's our answer. Y'all ready? In 3, 2, and the answer is torticollis. The sternocleidomastoid muscle is contracted, limiting the range of motion of the neck, causing the chin to point to the opposite side. Here's a funny story. Not a funny story, but a true story. But when my son was born, speaking of that, he's like 18 months today. But when he was born, he had, as he started to progress, he actually had torticollis to where he favored one side. And as he started to move, he wouldn't move his neck. He would turn his whole body as he started to move, which I thought was crazy. I'm like, bro, move your neck. But he couldn't. So we actually had to take him to physical therapy for that. And we had to do little stretches for him. And then, of course, babies are malleable, and he actually got, he got over that. So that's, think about it that way. So that's my quick little story. Hopefully you'll never forget it. All right. All right. On to the next one. All right. Here we go. Question number 8. An adolescent brings a physician's note to school stating that he is not to participate in sports due to a diagnosis of Osgood-Schlatter disease. Which of the following statements about this disease is correct? The condition was caused by the student's competitive swimming schedule. The student will most likely require surgical intervention. The student experiences pain in the interior aspect of the knee. The student is trying to avoid participation in physical education. All right, we got C's. We got C's. We got C's. Okay. All right. All right. I see y'all. Britney Spears. Wait, no, Britney Spears. Britney Treasure 93. My bad. I ain't mean to disrespect you like that. I didn't mean to do that. I'm sorry. All right. I'm going to give y'all 10 more seconds. 10 more seconds. I have never heard of this before. Oh, yeah, it's already gone. Oh, it's okay. Okay, cool. I'm glad you forgive me. All right, here we go. Here we go. Here's our answer in 3, 2. So the answer is C. The student experiences pain in the interior aspect of the knee. Osgood-Schlatter disease occurs in adolescence in the rapid growth phase when the infrapatellar ligament of the quadricep muscle pulls on the tibial tubercle, causing pain and swelling in the interior aspect of the knee. It's commonly caused by activity that requires repeated use of the quads, including track and soccer. I had it, and it's terrible. I bet it is, Lauren. I bet it is. I really bet it is. All right, hey, health promotions and maintenance. Try with rice inflammation, use a brace and support. Yeah, I would do that. I played soccer too. Well, I guess that makes sense. You fit the category, Lauren. You fit the category. Look, soccer and you. That's what I'm saying. All right, here we go. Here we go. On to the next. Question number 9. The clinic nurse asked a 13-year-old female to bend forward at the waist with arms hanging freely. Which of the following assessments is the nurse most likely conducting? Is it spinal flexibility, leg length disparity, hypostatic blood pressure, or scoliosis? I'm sorry. D. People are saying D. Okay. Maria says D. In case anybody was wondering, I think somebody had asked, hey, where did I got these questions from? I got them from nurselabs.com or nurselabs.com. I keep wanting to say nurse.org, but nurselabs.com. Mia says A. Okay. Darlene says D. I'm going to give y'all 10 more seconds. Appreciate the share, Aaron. Appreciate the share. Hey, we got a good amount of questions today. Adolescents get screened for scoliosis. You ain't got to scream at me. I see you. Miss Banks, you ain't got to yell. I hear you. All right, here we go. Here's our answer. Ready in 3, 2. And the answer, of course, Miss Banks, if she wants to scream it at me, is scoliosis. A check for scoliosis, a lateral deviation of the spine, is an important part of the routine adolescent exam. It is assessed by having the teen bend at the waist with arms dangling while observing for lateral curvature and uneven rib levels. Scoliosis is more common in female adolescents. So here's a funny story. When I was a surgical tech, I actually got to be a part of a spinal realignment with a 12-year-old girl who actually had scoliosis, and they like broke her spine in like 3 or 4 places, put rods in there, and I'm just like, bro, that shit's crazy. So I'm just saying, shout out to scoliosis. Not really, but I'm talking about in regards to the answer, so you know. All right, here we go. Question number 10. A clinic nurse interviews a parent who is suspected of abusing her child. Paint the picture, all right? Know what we're supposed to do as nurses when we suspect any type of child abuse or spousal domestic abuse or elderly abuse. Which of the following characteristics is the nurse least likely to find in an abusing parent? Low self-esteem, unemployment, self-blame for the injury to the child, or single status. All right, so the key word is least, right? There's a saying that I like to say, RTFQ. If you guys know what RTFQ is, go ahead and drop it in the chat for y'all that are normals, or that are, regulars that come here. RTFQ, the least, right? So 3 of these are going to make sense, and the one that doesn't is going to be your answer, right? All right, so we got C's. Self-blame for the injury of the child. Okay, got some C's. I'll give y'all read the full question. Yeah, we'll go with that. The F word, we'll go with full. I like that, user 83. We'll go with read the full question. I like more explicit words because I'm an adult, but not saying adults can't do that, but you know what I'm saying. But you got you. Here we go in 3, 2, and the answer is C, self-blame for the injury of the child. The profile of a parent at risk of abusive behavior includes a tendency to blame the child or others for the injury sustained. Abusers typically blame others, especially their partners, for the mistakes in their lives. This is related to hypersensitivity, but they are not necessarily alike. This occurs because most abusive people don't hold themselves as being accountable for the actions they commit. Instead, they'll try to shift the blame to the person that they have abused and somehow say that they deserve it or that they were forced into a corner. Avery, welcome. Hey, look, hey, here the question queen Avery is here, y'all. She is here. All right. Hey, psychosocial integrity, right? That is one of the sections on NCLEX, right? And this is where that falls under. Okay. All right. Here we go. On to the next one. All right. Hey, another break time. Make sure you guys participate. Give me all them likes. Don't troll my chat. I got these questions off nurselabs.com. I'm doing a summit. Make sure you guys go check that out. It's on the link in the bio, 7-day NCLEX course, and of course, thebootnurse.com. Here we go. Question number 11. A nurse is assigned to a pediatric rheumatology clinic and is assessing a child who has just been diagnosed with juvenile idiopathic arthritis. Which of the following statements about the disease is most accurate? The child has a poor chance of recovery without joint deformity. Most children progress to adult rheumatoid arthritis. Non-steroidal anti-inflammatory drugs, or NSAIDs, are the first choice in treatment. Physical activity should be minimized. Who said I just got hired as a medical scribe? This really helps. I'm glad this helps you. D's, we got D's and C's. Okay, all right, we got some little things that are different here. Okay. Sunshine Girl says B. Okay. All right. B. Is it Christiana says B with a question mark? She's like, I don't know. Hey, go with your gut and run with it. 9 times out of 10, your first choice of your answer is the right answer. Don't change it. Don't change your answer either. And that same thing applies. Rachel says C. Christiana says B with an exclamation. That's what I'm talking about. Camille says A. Camille, when did you get up in here? Lauren says C. Brandy says B. D, due to risk of injury. Okay. All right. We're thinking out. We're thinking. Hey, and if you guys decide you guys want to give me an answer, with your rationale behind it, cool. Throw it out there. All right. Here we go. Here's our answer. In 3, 2. And the answer is C. Non-steroidal anti-inflammatory drugs are the first choice in treatment. NSAIDs are an important first line treatment for juvenile idiopathic arthritis. NSAIDs require 3 to 4 weeks for the therapeutic anti-inflammatory effects to be realized. Physiological adaptation. AAG says fire. Yay, that's what I'm talking about. Physiological adaptation, third largest section on the NCLEX. Okay, and remember, if you picked A, B, or D, read the rationale and figure out why that answer was incorrect and what it falls under. Okay, this is how you retain your answers, or this is how you retain that knowledge while you are studying for your exam. Okay, any exam, but especially for the NCLEX. I'm still doing my nursing prereqs, but I love these live. Hey, Christiana, we do these every Monday, Wednesday, and Friday. I may not be doing them every Wednesday anymore. I might just do them every Monday and Friday. So, all right, here we go. Question number 12. Write out you could write out the rationales. I can't write out rationales because I'll start writing and then I'll fall asleep. It's kind of like reading a book while I fall asleep. So, a child is admitted to the hospital several days after stepping on a sharp object that punctured her athletic shoe and entered the flesh of her foot. The physician is concerned about osteomyelitis and has ordered a parenteral antibiotics. Which of the following actions is done immediately before the antibiotics is started? The admission orders are written, blood cultures are drawn, a complete blood count with differential is drawn, the parents arrive. B? Christiana, stop. Why you gotta scream at me? No, I hear you. B. Okay, Camille says B. All right. User 83 says B. All right. Maria says B. So is Bella. So is Kayla. All right. Brittany Treasure Spears 93 says B. All right. Tara says D. Tara says D. Okay. Hey, RTFQ, y'all. Make sure y'all read the question. Natalie says B. It's a habit. No, it's all good. Natalie says this. They have to allow what type of bacteria, or they have to know what type of bacteria it is to give the right antibiotics. Look at you, girl. Okay. Got to know the bacteria present. Listen, y'all so smart out here. All right, here's our answer. Here's our answer in 3, 2, and the answer is B. A blood culture is drawn. Antibiotics must be started after the blood culture is drawn, as that may interfere with the identification of the causative organism. You always want to get a culture, a blood draw, or whatever to know what type of infection you are fighting, right? I don't want to give somebody, doxycycline and they need vancomycin, right? I'm not going to try to, or vice versa. I'm not going to give you an overly powerful antibiotic and then you only needed something that, like Zosyn, something a little, with a little less kick on it. They don't actually know the actual bacteria before starting antibiotics. That is empathetical or empa. Okay, yeah. I mean, true. So it's but the whole point of it is that you want to draw something. So that way, hey, I'd rather draw something than start something, and we'll see what it does, and then once we get our labs back, we can pinpoint it with another specific antibiotic. So, all right, here we go. On to the next one. Question number 13. A 2-year-old child has sustained an injury to the leg and refuses to walk. The nurse in the emergency department documents swelling of the lower affected leg. Which of the following does the nurse suspect is the cause of the child's symptoms? Possible fracture of the tibia, bruising of the gastric nemus muscle, possible fracture of the radius, no anatomic injury. The child wants his mother to carry him. A, it's not D. Okay, it's not D. And that's another good way to do it. Is just like get rid of the ones that don't work. Like, so it's like, okay, I don't know this question. Okay, so you can't apply what you don't know, but apply what you do know, right? So if you know that something's not right, go ahead and mark it out. So now you have the chance of picking 3 or 2 instead of picking 4. So now your chances have increased from 25% to 33%, if that makes sense. Okay, appreciate the follow. Is CRNA worth it? I'm in my 2nd year of nursing, stuck behind CRNA, or stuck between CRNA and dental. Brandon, it all just depends on what you want. Honestly, I don't want to be a CRNA. I wanted to do that for a long time, but I don't want to do that anymore. It's not my calling. So it all just depends on you and what you want to do in the end for yourself. All right, I'm gonna give y'all 10 more seconds. Everybody's saying A. Obviously no one's saying D. So, all right, here we go. Here's our answer in 3, 2. And the answer is A. Possible fracture of the tibia. The child's refusal to walk combined with swelling of the limb is suspicious for fractures, right? And obviously, what 2-year-old doesn't want to be carried by their mother, when they have a physical injury, right? Physiological adaptation, third largest section on NCLEX. Just be mindful of that. What time is the Q&A? Karen, 5:30. 5:30 Central Standard Time. You know the deal. All 2-year-olds. My son is 18 months, wants to be carried at 2 years old. He's going to want to be carried because, his life is very, very hard. A toddler has recently been diagnosed with cerebral palsy. Which of the following information should the nurse provide to the parent? Select all that apply. Regular development screening is important to avoid secondary development delays. Cerebral palsy is caused by injury to the upper motor neurons and results in motor dysfunction as well as a possible ocular and speech difficulties. Developmental milestones may be slightly delayed, but usually will require no additional intervention. Parent support groups are helpful to share strategies and managing healthcare issues, or therapies and surgical interventions can cure cerebral palsy. It's either cerebral or cerebral. Don't matter as long as you say it. Now, if you were over here saying cerebral, I'm like, yo, I don't know what you're talking about. All the above, ma'am. That's fair. That's fair. Since it's select out of the apply, I will select all the above. Is it Sade or Sadie? You said and. And what? You mean A and D or you mean A, B, D? It's not E for sure. No cure? Okay. No cure! All right. Everything except, Freedom says everything except D. This is giving me nightmares, loving RN for the last 13 years. Hey, loving RN. Loving LPN. Loving LVN. All right. Hey, the word nurse and the fact that they have a license means that they're a nurse. Love them too. Hey, shout out to all my LVNs, my LPNs out there. I love y'all. Hey, straight up. And hey, just know I'll never let nobody disrespect y'all in front of me. And I put that on the dead homies. All right, here we go. Here we go. 10 more seconds. 10 more seconds, y'all. Kyra, I see you. On the way to B1. That's what I'm talking about. Is it Ali, CMA? Shout out to you, Miss Medical Assistant. All right, here we go. Here's our answers. All right, here's our answer. In 3, 2, it is B. I'm sorry, A, B, and D. It says people think we're not real nurses, ma'am. It literally says licensed practical nurse. I don't know who be saying that, but they out of pocket. Both are really interesting to me. Do you know any CRNAs, and do they like their job? Most CRNAs I know do like their job. Sir, she was saying that she's been an RN. Oh, my bad. Obviously, I don't know how to read, Miss Banks. I'm trying to get better. Okay, trying to read this and manage all at the same time. Okay. But yeah, so it's A, B, and D, part of the health promotions and maintenance. I know that is super tiny for y'all, and I know y'all can't read it. I ain't even gonna waste my time to read it, but you always want to read your rationales, okay? Always read your rationales. All right, here we go. Here we go. Question number 15. But what those paychecks say. Them paychecks, hey, yo, you gonna work hard for them paychecks. Do not get it twisted. Don't get it twisted, all right? All right, question number 15. A child has recently been diagnosed with Duchenne's muscular dystrophy, so DMD. The parents are receiving genetic counseling prior to planning another pregnancy. Which of the following statements include the most accurate information? We'll say DMD is an X-linked recessive disorder, so daughters have 50% chance of being carriers, and sons are 50% chance of developing the disease. DMD is a X-linked recessive disorder, so both daughters and sons have a 50% chance of developing disease. Is it C? Each child has 1 in 4, such as 25% chance of developing disease, or sons only have a 25% chance of developing this disorder. Hey, if you don't know, that's okay, because I'm going to tell you right now, when you go to take your NCLEX, there are going to be questions, especially if you're doing very well. There are going to be questions that they pull out and you have no idea. And you have no idea. And it's okay if you don't know, right? It's okay if you don't know. But I would rather you make an educated guess, right? And this is why practicing is so important, right? I'm a big proponent of practicing. You need to be doing 85 to 150 questions every day to every other day. And then following that, you need to be remediating yourself, reviewing, and reading your rationale. You switch to A. Hey, what do we tell you about switching stuff? This is on the medic and our EMT. Brittany, I think you said that before. I think you said that before. Here's our answer, y'all. Here's our answer. I definitely fail. I definitely feel like I failed walking out of the exam, but trust your gut. Everybody has that same exact feeling when they leave their exam, as they feel like they failed. Every single. You're not the only one. Trust and believe me. So the answer is A. The recessive gene, or the DMD gene, is located in one of the two X chromosomes in a female carrier. If her son receives the X bearing the gene, he will be affected. Thus, there is a 50% chance of a son being affected. Daughters are not affected, but 50% of carriers because they inherit one copy of the defective gene from the mother. The other X chromosome comes from the father, who cannot be a carrier. Yes. Shout out to the pops out there. Shout out to the dads. Let me go brush up. That's okay. That's the whole point. That's the whole point. Sometimes switching your answer, Rachel, you're right. Sometimes switching your answer is okay. However, when you switch your answer, you need to be able to tell me, not literally, but tell me and yourself 100% on why you were switching that answer. If you have any doubt, don't change it at all. Well, I just got accepted in nursing school. What am I signing myself for? Ma'am, Emily, yeah, look, I'm trying to tell you, your life is about to be on and popping. Hey, break time. Hey, we're doing NCLEX questions. Make sure you guys participate. I'm kind of funny, whatever. More likes, more gifts or whatever, more questions y'all get. You know the deal. Give me all them likes. Don't troll my chat. I got these questions off nurselabs.com. I'll be doing a nursing school summit specifically talking about how to conquer the new generation NCLEX. And it's presented by True Love and Pink Monic, and that link is in my bio. Make sure you guys go sign up. It's free, FREE, because I'm about free. You know what I'm saying? 7-day NCLEX course. That's my course I created, $48. Once you get it, it's yours. It's yours forever, at least for right now in the pre-launch phase. And then, of course, go check out thebootnurse.com. Anybody looking for one-on-one tutoring, I got you on that as well. All right, here we go. Question number 16. A client is scheduled for a percutaneous transluminal coronary angioplasty. That's a mouthful, y'all. Just for RNs only. Is it Diane? What are you talking about? What do you mean specifically? The nurse knows that the PTCA is the surgical repair of a diseased coronary artery, placement of a automatic internal cardiac defibrillator, a procedure that compresses plaque against the wall of the diseased coronary artery to improve blood flow, or non-invasive radiographic examination of the heart. Tammy, thank you for the share. Appreciate you. Thanks so much to learn. You got a lot to learn. Trust me, and you got time to do it. We got A's and we got C's. Okay, got a lot of C's. Got a lot of C's out here. All right. Shout out to all 224 y'all that are in here rocking with me. If you guys are new here, we're doing NCLEX questions, nursing style questions. My name is Kevin. Go by the Boot Nurse on all platforms. Hey, if you missed this live, I always put them up on YouTube, so make sure you guys go check that out. My YouTube is the Boot Nurse. Trust me, you cannot miss it. Not A, because you're not repairing, you're opening the vessel. Look at you. Is it Maru? Kurt says A, question mark. Okay. Hey, but I also want to know who you are, where you're from, where you're at in your nursing journey, right? I don't care where you're at in your nursing journey. Prereqs, in school, graduated, NCLEX, been a nurse for a year or 40 years. I had a bunch of people jump up in here. So, hey, you know, let us know. I'm a therapist, but I'll stick around. Hey, Val, stick around. Salute to you. Graduating in December. Jordan says stint. I'm not interested in nursing, just curious and interested. Shout out to you, Kurt. Appreciate you participating. Senior, get me out of here. All right, here we go. Here's our answer, y'all, in 3, 2. And the answer is C. Procedure that compresses plaque against the wall of the diseased coronary artery to improve blood flow. PTCA is performed to improve coronary artery blood flow in a diseased artery. It is performed during a cardiac catheterization. Aorta coronary bypass graft is the surgical procedure to repair a diseased coronary artery. Okay, it's basically a stent. Yeah, Brittany, basically a stent. However, when you take NCLEX, you know, they may not say stent. That they, you know, they want to go around and, you know, beat around the bush. Oh, I learned something new. That's what I'm talking about. You learn something new every day. All right. I just took my T's 3 days ago and I passed. Shout out to you, baby girl. Baby girl. Shout out to you. Passing that T's, graduating my PN. I'm scheduled for my NCLEX in 2 weeks. Shout out to you, ma'am. Shout out to you. Currently taking micro. All right. I applied for nursing school in February. Any advice? Nursing school in February. Be ready to cancel everyone in your life that is of not importance, as well as anybody or anybody, anyone, anything that is a distraction because your life is about to drastically change. All right, here we go. Here's question number 17. A newborn has been diagnosed with hypothyroidism. In discussing the condition and treatment with the family, the nurse should emphasize they can expect the child will be mentally retarded. I wouldn't say that, but whatever. Administration of thyroid hormone will prevent problems. This rare problem is always hereditary. Physical growth and development will be delayed. We got some B's, we got some D's. Throw some D's on it. All right, what else we got? I'm gonna give y'all 20 seconds. Never, what says never use always in medicine. That's a trigger word. That's a trigger word. Watch out for those trigger words. The trigger words will definitely get y'all. A is out of pocket, ain't it though? Hey, not my questions, y'all. Not my questions. All right, here we go, y'all. Here we go. Here's our answer in 3, 2, and the answer is administration of thyroid hormone will prevent problems. Hey, what's the name of that thyroid hormone? What's the name of that medication? I thought the R word was prohibited through rehab, through the Rehab Act. Probably. Hey, these aren't my questions. I'm just saying. Synthroid, right? Levothyroxine, right? There you go. There you go. Levo. Hey, so here's the thing. Don't necessarily say levo, right? Because what's another medication that starts with levo? What's another medication that starts with levo? Yeah, Levophed, right? And what is Levophed? What type of medication is that? I mean, we know levothyroxine is a thyroid medication, but what is Levophed? It's a pressor, right? So don't be coming out here saying like I'm giving them levo. I'm like, okay, which one? You better say the whole thing. Don't be giving me partials. All right, don't be giving me partials. All right. Levodopa. So what's levodopa? Since Natalie brought it up, what's levodopa? What's another name for levodopa? Oh, haha, I'm thinking antibiotics. Rachel, girl, come on. All right, here we go. Question number 18. A priority goal of involuntary hospitalization of a severely mentally ill client is reorientation to reality, elimination of symptoms, protection from harm to self or others, return to independent functioning. Why couldn't they just say in the last question, severely mentally ill? Why couldn't they say that? We got C's. But no, they want to be different and they want to say the R word because, safety first. Remember, when you take your NCLEX, it's all about nurse safety. They want to know, can you perform safely as a basic level nurse? Remember, you're not supposed to know everything. I knew it. Hypo is thin. Obviously, I can't remember. How I remember from Simple Nursing. Simple Nursing is good stuff out there. I think it's C. Okay, shout out to you. The Coco Chronicles says C. Jen says C. Is it Bino? Bino? Dino? Bino. Like albino or Bino? It says A. Turkey says C. Quest got next. Says, what'd you say? You said C. Okay. I appreciate everybody. Make sure you guys like, share, follow. I need all them shares. I need all them likes. I need all them follows. Here's our answer. Here's our answer in 3, 2. Sorry if you guys hear my co-host in there, but once again, he's 18 months and he just thinks he can do whatever he wants, so he may babble. You know what I'm saying? All right, here's our answer. Our answer is C, protection from self-harm and harm to others. Involuntary hospitalization may be required for persons considered dangerous to self or others, or for individuals who are considered gravely disabled. All right, Michelle and King Cozy, appreciate the follow. Linda, ma'am, how are you? Hello. Appreciate all 192 of y'all up in here. Cameron and Elise, appreciate the follow. Thank you. Here we go, y'all. Question number 19. A 19-year-old client is paralyzed in a car accident. Which statement used by the client would indicate to the nurse that the client was using the mechanism of suppression? I don't remember anything about what happened to me. I'd rather not talk about it right now. It's the other It's the other entire guy's fault. He was going too fast. My mother is heartbroken about this. Brittany says A. Is it none? Is it nuddy? Nudie? Nudie. Nudie. Is it B? Hopefully I said it right. Autumn Michelle says B. Michaela says B. Ending. Oh, okay. I got you. All right. B's, D's, some B's. We got some D's. Throw some D's on it. On it. All right. A or B, ma'am. I need one answer. I'm gonna give y'all 15 seconds. Is it All right. A. But I wouldn't be surprised if it was B. Hey, Kurt. Hey, it doesn't hurt. It doesn't hurt for you to throw out an answer. It doesn't hurt for you to throw out an answer. All right. He simply doesn't remember suppression is an intentional act. There you go. C, change my answer. Celeste, remember when we change answers, right? You got to definitively be able to tell yourself, like, this is my answer. If not, you could have very well changed your answer from something that was correct to incorrect. All right. So here we go. Here's our answer in 3, 2, and the answer is A. I don't remember anything about what happened to me. Suppression is willfully putting an unacceptable thought or feeling out of one's mind. A deliberate exclusion, voluntary forgetting is generally used to protect one's own self-esteem. I hate this subject in nursing school, don't we all? Suppressed memories, yeah. Appreciate the, who gave me the, is it El Chermino? Appreciate the rose, my good sir, appreciate it. All right, so let's look at B. Denial is a defense mechanism proposed by Anne Freed, who involves a refusal to accept reality, thus blocking external events from awareness. If a situation is just too much to handle, the person may respond by refusing to perceive it or by denying that it exists. Okay, that's why I said it's super important to read these rationales and why it's right, but then you also need to read the rationale for your answers that are incorrect to see why they are not right specifically for this question. Okay, Val says that makes sense. Here I go overthinking. Steph, what I done told you? What I tell you about thinking? All right, what I tell you about thinking? All right, and also psychosocial integrity. That's what it falls under. Okay, part of the category the client needs. All right, here we go. Question number 20. The nurse is caring for a woman 2 hours after a vaginal delivery. So think about what happens when a mother pushes a baby out of her hoo-ha, right? What's popping out here? All right. Documentation indicates that the membranes were ruptured for 36 hours prior to delivery, which are the priority nursing diagnosis or diagnoses at this time. What are the primary nursing diagnoses at this time? Is it altered tissue perfusion, risk for fluid volume deficit, risk or a higher risk for hemorrhage, or risk of infection? Remember, so what are the key things that stick out to you in here, right? The key things. Rachel says D. Rachel, are you saying D because you're following the crowd? Val, appreciate the follow. Lex says C. Michelle says C. Linda says C. Is it Pearl? Says D. Rupture membranes. Okay. D. After 12 hours, it's infection. Look at you. Okay. All right. C. Membrane rupture for 24 hours increases what? Infection risk. Okay. I'm gonna give y'all 10 seconds. Give y'all 10 seconds. Can't be ruptured for longer than 24 hours. Okay. So you got to think about that. So she may have given birth 2 hours ago, right? She may have given birth 2 hours ago. However, for the fact that her membranes were ruptured for longer than 36 hours, what is the thing that is like, what is she most susceptible to having? Because, you know, like where does that follow? Where does it fall under? All right, here we go. So here's our answer in 3, 2, and of course the answer is risk for infection. Membrane rupture over 24 hours prior to birth generally increases the risk of infection for both mom and newborn. Rupture of membranes result from a variety of factors that ultimately lead to accelerated membrane weakening. This is caused by an increase of local, cytokines or cytokines, whatever you want to call it, an imbalance in the interaction between matrix, metalloproteinase and tissue inhibitors of matrix metalloproteinase. Increase collagenase and protease activity, and other factors that can cause increased intrauterine pressure. I'm in mother baby right now. Yeah, you better know this. You better know it. My water broke at 5 a.m. But I had my kid at 10:30, and I understand this question exactly. You can understand this question. That's like a women that are in here can 100% relate to that, right? Physiological adaptation, third largest section on the exam. All right. Hey, we're at another break. Doing NCLEX questions. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. My name is Kevin. I go by the Boot Nurse on all those platforms. Make sure you guys go over and follow. Make sure you guys participate. I'm kind of funny. I don't feel like I'm all that funny today, but y'all already know what the deal is. Give me all them likes. Give me all them shares. Give me all them follows. I want them all right now. Do it. I love you. Don't troll my chat. You troll my chat, I'm gonna ban that ass. I got these questions off nurselabs.com, so go over there and check those questions out for yourself. I will be doing a nursing school summit on this coming Sunday, y'all. This coming Sunday at 1 p.m. Eastern Standard Time, so 12 p.m. Central Time. And I'll be talking about the new generation NCLEX. All right, so it's free to sign up. The link is in my link tree in my bio. Go check that out. 7-day NCLEX course. That's the NCLEX course that I created. $48. Once you get it, it's yours forever. You better get it now, because if you don't, it's going away soon. And just letting you know right now. Anyways, and also check out thebootnurse.com. I do one-on-one tutoring if that's what you want. So that's over there. Go over there and check that out. Here we go. I'm Kiki. Do you love? I'm sorry. Fourth quarter nurse, almost done. Shout out to you. I graduated in December. Yes, ma'am. I'm a junior quarter in my accelerator program. All right, Miss Autumn. I see you. I see you. All right, y'all. Here we go. Question number 21. A 3-year-old had a hip spica cast applied 2 hours ago. In order to facilitate drying, the nurse should what? Expose the cast to air and turn the child frequently. Use a heat lamp to reduce the drying time. Handle the cast with the abductor bar, or turn the child as little as possible. First semester LPN. Shout out to you, Miss Tay. All right. We got some A's out here. We got some A's. Scrolling on TikTok. Wait, hold up. Scrolling on TikTok to avoid studying for NCLEX, and here comes NCLEX prep. Ma'am, you belong here. Hey, since you just said that, go ahead and follow. Stop playing games, girl. Go ahead. You know you need to be here. You know you need to be here. All right. I'm gonna give y'all 10 more seconds. All right. 10 more seconds. Make sure y'all smash that like button, y'all. Make sure y'all smash it. I don't even know what sound, but A sounds good. That's fair. That's fair. Appreciate the follow. All right, here we go, y'all. Here we go. Here we go. Is it Daniela? Daniela. I was about to say Deliana, and I don't know even know why. But all right, here we go. Here's our answer, y'all. In 3, 2. Daniela, look at that. I already gave me a follow. That's what I'm talking about. Hey, look, somebody guessed and they got it right. Expose the cast to air and turn the child frequently. The child should be turned every 2 hours. What, right? With the surface exposed to the air. Cast and splints hold the bone in place while they heal. They also reduce pain, swelling, and muscle spasms. I don't even know what half this stuff means. That's okay. That's okay. That's okay if you don't know what half it means. The biggest thing is that you're exposed to it. It's not about memorization, right? It's not about memorization. It's all about being familiar. In school, it's about memorization. Also, pharmacological and parenteral therapies. That is the second largest section on NCLEX, okay? Second largest section on NCLEX. All right, here we go. Question number 24. How often do you do NCLEX questions live? Ma'am, I do these 3 times a week, Monday, Wednesday, Friday at 5:30 Central Standard Time. And I think I'm going to do away with Wednesdays. I don't know. We'll see. We'll see. I don't really get that much traction on Wednesdays. So we'll see how that goes. A client is scheduled for an intravenous pilogram IPV. In order to prepare the client for this test, the nurse would what? Instruct the client to maintain a regular diet the day prior of the examination, restrict the client's fluid intake 4 hours prior to the exam, administer a laxative to the client the evening before the exam, or inform the client that the only one X-ray of the abdomen is necessary. We got B. Autumn says B with a question mark. You're going to guess B? You know what? That's okay. Daniela says B. Okay. Right? Who in here can tell me what an IPV is? Who can tell me what that procedure is? Tell us what the procedure is. Is it Farima says C. And I don't care if you Google it. Google can definitely be your best friend. Trust and believe me. A literal art says A, question mark. Diane says C. Chainlink says C. Sadie says C. Using dye. Okay. All right. Evaluate kidney. Okay. All right. Uses dye. Shoots dye through the veins. Right. It's kidney. Yep. B or C. All right. Cool. All right. an X-ray exam. It's several X-rays, right? All right, here we go. Here's our answer, y'all. Here's our answer. Here we go. Here we go. In 3, 2, and the answer is C. The answer is C, y'all. However, you were right. Most of y'all were right, right? We're talking about the injection of contrast material to evaluate the kidneys, ureters, and bladder. That is what it does, right? However, the answer is C. Bowel prep is important because it allows greater visualization of the bladder and ureters. IPV is an X-ray exam that uses an injection of contrast material to evaluate the kidneys, ureters, and bladder and help diagnose blood in the urine or pain in the side or lower back. An IPV may provide enough information to allow the doctor to treat with medication and avoid surgery, right? Is this for T's or NCLEX? King Cozy, this is for NCLEX. It is for the N of the CLEXs, okay? All right. Hey, pharmacology, right? Pharmacology, second largest section on the NCLEX, all right? Hey, I just want to let you guys know that the NCLEX, the 3 largest sections are management of care, LPNs, if you're doing the LPNs, it's the coordinated care, and then pharmacology and physiological adaptation. Those 3 sections alone make up 44 to 49% of the entire NCLEX exam, okay? The entire NCLEX exam, right? So think about that. Them 3, and there's 8 sections, 8, all right? Following a diagnosis of acute glomerulonephritis, I always mess it up, AGN, and their 6-year-old child, the parents remark, "We don't know how he caught the disease." The nurse's response is based on an understanding that AGN is a streptococcal infection that involves the kidney tubules. The disease is easily transmitted or transmissible in schools and camps. The illness is usually associated with chronic respiratory infections. It is not caught, but it is a response to a previous B hemolytic strep infection. Oh, this is a good one, y'all. This is a good one. A, D's. Somebody got some A's out there. Throw some D's on it. All right. I'm torn. Camille, you're torn? You just took, Brandy, I'm assuming you said you just took this exam. You got A, D, C. Okay. All right. I appreciate everybody jumping up in here. Make sure you guys like, share, follow. Just took that exam. All right, Brandy, what's the answer then? What's the answer then? It is from a strep infection that affects the kidneys. Oh, but affects the kidneys. Sticking with D. Okay, I say D. Can't it also be lupus? Do you see lupus as a question on here? Or as an answer? Don't do that to yourself, all right? Don't do that to yourself. Don't add in things. Don't add in more things that are not there, because then you'll just totally get the question wrong, all right? Here we go, y'all. Here we go. Stick to your answers. There you go. Here we go. Here's our answer, y'all, in 3, 2. Kaylee, appreciate the follow. And the answer is D. It is not caught, but is in a response to a previous B hemolytic strep infection. AGN is generally accepted as an immune complex disease in relation to an antecedent streptococcal infection of 4 to 6 weeks prior, and is considered a non-infectious renal disease. Yup. When in doubt, pick strep. I mean, I like the way you think. I like that. It may not be right. It may not be right, but I like the way you think. You like see your way out. C's get the degrees, baby. Physiological adaptation. All right. Here we go. Pretty nice 305. Appreciate the follow. Thank you. Appreciate the shares. All right. Question number 24. The nurse is caring for a 20-pound, 9-kilogram, 6-month-old with a 3-day history of diarrhea, occasional vomiting, and fever. Peripheral intravenous therapy has been initiated with 5% dextrose and a 0.33% normal saline with 20 milliequivalents of potassium per liter infused at 35 milliliters per hour. Boy, ain't that a mouthful. Which finding should be reported to the healthcare provider immediately? Meaning I need to tell this doctor that something wild is going on so we can fix this patient. Is it 3 episodes of vomiting in an hour, periodic crying and irritability, vigorous sucking of a pacifier, no measurable voiding in 4 hours? We got D's. Is it Ali says A, Heather says A, Daniela says D, Erica says D. 2 shoes, I'm about to say 2 shoes, says D. Got D. Oopsie says A. All right. Okay. Who said they're still in high school? Who said that? I'm still in high school. Mads, you're still in high schook studying at community college. Shout out to you. Shout out to you, youngin. Welcome to the group. Dehydration and kidneys not working. All right, don't give K. Look at that one. Go ahead, Shayna. Girl, I'm talking about. Thinking. All right, here we go, y'all. Here's our answer. All right, here's our answer in 3, 2. The answer is D, no measurable voiding in 4 hours. The concern is possible hyperkalemia, right? Which could occur with continued potassium administration and a decrease in urine output since potassium is excreted via the kidneys. Successful management of acute hyperkalemia involves protecting the heart from arrhythmias with the administration of calcium, shifting potassium into the cells, and enhancing the elimination of potassium from the body. Hey, so how do we shift our potassium into the cells and then eliminate it out of the body? How do we do that? What medications will we give? What medications? Hey, I need answers down there. I need answers right now. Shout out to all 250 y'all. Calcium. What else? Lasix, yeah, because Lasix can put K-exalate, right? Right? Insulin and D50. I would say insulin. Okay, insulin, glucose, yeah. Diuretics, right? Regular insulin, K-exalate, yeah. Calcium gluconate, diuretics. Yep. Okay, all right. Thinking about those cardiac meds. Okay, get all that nastiness out of there. All right, here we go. Physiological adaptation, y'all. Second largest section. All right, who is that? Rico. Appreciate the follow. I don't know if you are a sir or a ma'am, but I appreciate you for following. Question number 25. While caring for the client during the first hour after delivery, the nurse determines that the uterus is boggy and there is vaginal bleeding. What should be the nurse's first action? All right, so we're on a list here, a systematic approach. Number 1 through 4. What is the very first thing I want to do? Check vital signs, massage the fundus, offer a bedpan, check for perineal lacerations. We got B's. Who said I wish? I wish this one was on NCLEX. This probably would have been a good question. This probably would have been a good question on NCLEX, right? So NCLEX is based off of memorization, remembering, application and analysis, right? So if you're doing memorization or remembering, those aren't passing level questions. Analysis and application, those are the questions that you want. Those are the type of questions that you want on NCLEX because it allows you to use critical thinking and your clinical judgment. You don't do that when you memorize. All right, here we go. We got some B's, massage, and start pit. Where does it say start pit at? Come on, Becca. Where does it say that? Don't give more information than you need, because if you do that, not saying that the same thing about pit, but don't give more information than you need. Okay, but the answer is massage the fundus, which is B. The nurse's first action should be to massage the fundus until it is firm and uterine atony is the primary cause of bleeding in the first hour after delivery. Approximately 3 to 5% of obstetric patients will experience postpartum hemorrhage. Annually, these preventable events are the cause of 1/4 of maternal deaths worldwide and 12% of maternal deaths in the United States. I learned this in ENT school. Yeah, because you could be going to go pick up somebody, they'll deliver in the back of somebody's rig, and then hey, you could very much have that happen to you. All right, this shit is painful. I'll tell you. Look, let me tell you something. You think this is painful? Wait till you get out to these floors and see how painful that is. All right, but hey, it's all good. All right, shout out to y'all. Physiological adaptation. Hey, quick little break. We're doing NCLEX questions. Participate. I love y'all's participation. I love how you guys are doing this. What should I expect for the LPN NCLEX exam? I'll tell you in a second. Don't troll my chat. Give me all the likes. Nurselabs.com is where I got the questions. I'm doing a nursing summit talking about the new generation NCLEX on this coming Sunday. So go check that link out in my bio. 7-day NCLEX course is $48. Check out the bootnurse.com. Boom. I think I should just do it like that. I appreciate all the follows. Here we go, y'all. Question number 26. All right. The nurse is assessing an infant for developmental dysplasia of the hip. Which finding would the nurse anticipate? Right? Unequal leg length, limited adduction, diminished femoral pulses, or symmetrical gluteal folds. We got A. Is it J's off? J's off. Oh my God. I cannot believe I just said that. J's off. Appreciate the follow. While D was a tricker, right? Got B, B, B. Is it Nika? Appreciate the follow. What else? We got A's. We got A's. Shout out to all 190 of y'all. If you guys are new here, we're doing NCLEX/nursing questions. Make sure you guys like, share, follow, smash it, smash it. Seasoned okay. Seasoned okay. No comment. Appreciate the follow. Is it Hayden? Appreciate the follow. All right, y'all. What are we thinking? Give me them answers. What are we thinking? All right, cool. Here's our answer. Y'all ready? Here we go. Here we go. In 3, 2. And the answer is A, unequal leg length. Shortening of a leg is a sign of developmental dysplasia of the hip. The hip is a ball and socket joint, right? Think about that. In a normal hip, the ball of the upper end of the thigh bone or the femur fits firmly into the socket, which is part of the large pelvic bone. In babies and children with developmental dysplasia, which is dislocation of the hip hip joint has not formed normally. The ball is loose in the socket and may be easily dislocated. A 200. What are we talking about? Dang, it's all good, Shayna. They have addiction. They have addiction. The doctor. I mean adduction. Feels the click. Yeah, I like addiction. I like. What are we addicted to, Rachel? What are we talking about? It can also mean a hip fix in an adult. It sure can. It sure can. Right. All right. Physiological adaptation. Right. Physiological adaptation. All right. I think I'm just gonna start yelling out what part of the NCLEX? What client needs? Like what section is it? All right. Here we go. Question number 27. To prevent a oh my God, Valsalva maneuver in a client recovering from an acute myocardial infarction, the nurse would what? Assist the client to use the bedside commode, administer stool softeners every day as ordered, administer antidysrhythmics PRN as ordered, or maintain the client on strict bed rest. Bees. Okay, all right. Got some B's out there. Autumn says B. User 83 says B. Kimberly says B. Straining. B. Avoid straining. Okay. All right. Eric says B. I'm going to give y'all about 15 more seconds. Is it Asia? Appreciate the follow. Thank you. Avoid straining. Yep. Okay. B. Maria. I was like, what is that? And it's a B. Oh, I got you. Well, seems I may have a lag. You might want to get them interwebs taken care of over there. Eric, appreciate the follow. Burnt mom. I really hope you aren't burnt. I really hope you're safe out there, but I appreciate the follow. All right, here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer, of course, is B. Administer stool softeners every day as ordered. Administering stool softeners every day will prevent straining of defecation, which causes the Valsalva maneuver. If constipation occurs, then laxatives would be more necessary to prevent straining. If straining on defecation produced the Valsalva maneuver and rhythm disturbance results, then antidysrhythmics would be appropriate. Burnt out. Oh, okay. I got you. Hey, done are the days of burnt out. Hey, I'm gonna tell y'all something right now for y'all's mental health. If you're getting burnt out wherever you are or whatever job that you're in, especially if you're one of my nurses that are out here working in the field, hey, find something different. Hey, get your life back. Get your quality of life back. Stop playing games out here. All right. Hey, pharmacological and parenteral therapies. That is the what largest section on NCLEX. Let's hear it. Akira, appreciate the share. Rudy, appreciate the follow. All right, here we go. Definitely burnt out studying for this NCLEX. Hey, that's temporary. Nini, this is temporary out here. Banana second. You're right. Pharmacology, second largest section. There you go. Question number 28. On admission to the psychiatric unit, the client is trembling and appears fearful. The nurse's initial response should be to what? Give the client orientation material and review the unit rules and regulation. Instruct him or her and accompany the client to the client's room. Take the client to the day room and introduce her to the other clients, or ask the nursing assistant to get the client's vital signs and complete the admission search. All right, what do we got? We got B. Shout out to all 184 y'all. Velicity, pass my NCLEX RNO 927. It's a beast. Learn content. That's what I'm trying to tell y'all. Everybody give Felicity her flowers. Shout out to you. Welcome, welcome, welcome to the greatest shit show you will ever be a part of. Hey, welcome to nursing. Everybody give her her love and give her shout out. All right. And that's why I try to say, hey, I am a content person. I am 100% a content person. I am not about that. I am not about telling y'all, hey, about these tricks, about blah, 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 blah. They're not necessarily tricks. You have to have a basis. You have to have a base of content in order for you to understand and apply NCLEX to NCLEX style questions. You have to. That helps with your critical thinking and your clinical judgment. All right. So never forget that. All right. So our answer is B, introduce him or her and accompany the client to the client's room. Anxiety is triggered by change that threatens the individual's sense of security. In response to anxiety in clients, the nurse should remain calm, minimize stimuli, and move the client to a calmer, more secure / safe setting. And obviously, D is not it because we don't delegate. We don't delegate what we eat to anybody else if we're the RN, right? Congratulations, took mine yesterday and waiting on results. Tara, I'm not sure how to say. Hey, I'm not sure. However, you're going to rock that. You're going to rock it. We're going to speak it into existence. I will say it for you. Tara, you passed that NCLEX, and I want you to come back next week, and I want you to let us know. Or you can send me a message and tell me. I'm all about it. I love giving people their shout-outs all the time. All right? Hey, management of care is what section? It is what section of the NCLEX? All right, here we go. Here we go. Mandy, appreciate the follow. Here we go. During the admission assessment, it says pray for me. I test Monday. Nikita, you got this. You got this. On Sunday, Nikita, you better not be anywhere studying for nobody. You better be just chilling out. No, I didn't do the trick. That's okay. You don't have to do the trick. A lot of times I tell people I don't recommend it because it'll give you even more anxiety, especially if you do it wrong. It'll charge you your money and it won't give it back to you. It's all kinds of stuff. If anybody wants to know how to do the trick, you can go to my page. Because I actually did a walkthrough on how to do the piercing beard trick. Nurse Cass, hey, shout out to Nurse Cass. She's one of my moderators. She's a goon out here, and she will fight you. During the admission assessment of the client with chronic bilateral glaucoma, which statement by the client would the nurse anticipate since it is associated with this problem? I have constant blurry vision. I can't see out of my left side. I have to turn my head to see my mom. I have specks floating in my eyeballs. All right, we got A's. Shy, appreciate the share. All right, I already seen a bunch of people already answer this, so I think I'll just go ahead and jump. Bilateral means that it's not B. See, apply what you know so you can eliminate, right? So here we go. Here's our answer, y'all, in 3, 2, and the answer is C. The answer is C, y'all, right? Intraocular pressure becomes elevated, which slowly produces a progressive loss of peripheral visual fields in the affected eye, along with rainbow halos around lights, not light, right? Daniela, shouldn't have changed your answer, right? Intraocular pressure becomes elevated from the microscopic obstruction of the trabecular meshwork. If left untreated or undetected, blindness results in the affected eye. I'll have to do Powell's course, I suppose. Nah, Brittany, stay. No. Don't go nowhere. No. You stay here. You stay here. You stay here with us. And you endure this pain. I did not see that coming. Wow. Really, Shayna? Shayna, I was about to give you a 600 for that, but, since I'm over here laughing, I ain't going to do it. I got to stop changing my answer. I'm trying to tell you, you will be your own worst enemy if you keep changing your answers. I can never remember glaucoma things. So, well, that's maybe one of the things that you could brush up on. Just learn this in MedSurg. So, was it Leanna? You should be able to get this. No problem. Hey, physiological adaptation is what? All right, here we go. Question number 30. A client with asthma has low-pitched wheezes present in the final half of exhalation. 1 hour later, the client has high-pitched wheezes extending throughout exhalation. This change in assessment indicates to the nurse that the client has increased airway obstruction, has improved airway obstruction, needs to be suctioned, or exhibits hyperventilation. You guys hear that laugh? It's contagious, let me tell you. But he's a demon. He's a demon. Abigail, appreciate the follow. Thank you. Hospice. Sandy, when did you get in here? Did I miss you? Got A. Okay. Abigail. Abby says A. Is it Alicia or Alicia? Appreciate the heart. Thank you. We're taking our test like the NCLEX on our computer. We aren't allowed to go back. You're right. We're not going back. Did somebody ask to go back? Because we ain't going back. ATX, baby. Appreciate the follow. Yes. Sorry. Been busy. No, you good, Sandy? You already know. Hey, regulars that come in here, I remember y'all. But all right, y'all. Here we go. Here we go. Here we go. Here's our answer in 3, 2. Our answer is A. Has increased airway obstruction. The higher pitch a sound is, the more narrow the airway. Therefore, the obstruction has increased or worsened. With no evidence or secretions, no support exists to indicate the need for suctioning. Right. So the smaller the pipes get, the harder it is for you to breathe. How is your leg? Oh, I appreciate you asking. Swelling's gone down. I'm still on no weight bearing for the next 4 weeks. So I get to do this and hang out with y'all more. So, your boys got to love that. All right. Physiological adaptation is what section on the NCLEX? All right, here we go. Hey, a little bit of break. I'm going to take 30 seconds. Don't you leave me, all right? Hey, NCLEX questions, that's what we're doing. Participate, that's what y'all are doing. Like, give me stuff. That's what I'm doing so I can give y'all more questions. Give it all to me. Hey, troll my chat. If you're doing it, I'm getting rid of you. And then Cass is going to ban you, all right? Nurselabs.com is where I got these questions. I'm doing a nursing school summit. I want you guys to check that out. The link is in my bio. Make sure you guys like, share, smash, all that good jazz. 7-day NCLEX course. Hey, if you are a new student and you don't graduate for like a year, 2 years, or whatever, and if you want to get a jump on an NCLEX that you're going to get forever with content and NCLEX style questions that are going to be uploaded there for $48, that's not a bad gig. I'm telling you right now, that price is going to go up. And also check out thebootnurse.com if you're looking for one-on-one tutoring. I'm just saying. All right, here we go. Question number 31. Which behavioral characteristic describes the domestic abuser? Alcoholic, overconfident, high tolerance for frustration, or low self-esteem? And if you guys think about this kind of is like the question that we had before. Okay, who is that? Molly, I appreciate the follow. We got D's. Okay, appreciate all 192 of y'all rocking in here with me. If you guys are new here, my name is Kevin. Make sure you guys like, share, smash that like button. Stop being greedy your whole life and give them to me. Give them to me. Clean, appreciate the follow. Two Shoes says A. Sandy says D. Is it Larissa? Larissa says, or Larissa's following, so I appreciate you. Thank you. Appreciate the follow. All right, I'm going to give y'all 10 more seconds. Miss Coco Chronicles, what'd you say? You said D. Kurt said shoot. I'm going to go with B. Go with B, Kurt. Go with B. Is it Relentless and PIC? Appreciate the follow. All right, y'all. Here's our answer. In 3, 2. And the answer is D. Low self-esteem. Batterers are usually physical or psychologically abused as children or have had experiences of parental violence. Batterers are also manipulative, like some of you people in my chat. I'm just playing. Have low self-esteem and have a great need to exercise control or power over partners. All right. I'm just saying. Don't be coming over here and be like, that's a body. Hey, anybody ever hear that? Like, that's a body? Like, I'm trying to tell y'all, anybody that comes to me and says that that's a body, obviously you got low self-esteem and you batter and you manipulate, and I'm gonna need you out of my chat. So I love y'all. Appreciate y'all. We're going on to the next one. Hey, psychological integrity. All right. Psychological integrity. Who's that? Kimmy, I appreciate the follow. User 61, appreciate the follow. Hi, Monica, repeat text sticker for RN. When does your 7-day NCLEX course group start? So the course is actually it's a self-paced on-demand course. And I'm currently in the production of my course where I'm doing each section. I will, here in the near future, start doing it live. But I have to complete everything first, all right? But it's coming. I'm just saying. And if you need coaching, I got you on that too. Question number 32. The nurse is caring for a client with a long leg cast. During discharge, teaching about appropriate exercises for the affected extremity, the nurse should recommend isometric, range of motion, aerobic, or isotonic. We got A's, we got B's. Mandy says A. Relentless says A. Camille says A. Shayna says A. All right. Clean says B. We got A. Okay. Daniela, what did I tell you about that question mark? What did I tell you about that? All right, I'm gonna give you guys 10 more seconds. Appreciate the share. Thank you. Sadie says B. I changed my mind. B. Camille, you know better. Camille, you know better. We've had this conversation before, man. Okay. All right. I forgot what these terms mean. Hey, now you got a good brush up. Savage says A. All right. Hey, I love your enthusiasm. All right, here we go. Here we go, y'all. Here's our answer in 3, 2. And the answer is A, isometric. The nurse should instruct the client on isometric exercises for muscles of the calf extremity, i.e. instruct the client to alternately contract and relax muscles without moving the affected part. So it's kind of like Kegels for your quads and your hamstrings. Wow, imagine that. Look at that. Look at that, Camille. Look at that. Oh my God, look at that. See, Camille, I done told you now. I done told you. All right, hey, health promotions and maintenance. All right, health promotions and maintenance. All right, here we go. Question number 33. Hey, if you guys are new here, my name is Kevin. We appreciate you guys rocking with me. We are doing nursing and NCLEX type questions. So make sure you guys like, share, and follow. Here we go. A client is in her 3rd month of her first pregnancy. Shout out to new moms out here. During the interview, she tells the nurse that she has had several sexual partners and is unsure of the identity of the baby's father. Which of the following which of the following nursing interventions is a priority? Oh my God. Counseling the woman to consent for HIV screening, perform tests for sexually transmitted diseases, discuss her high risk for cervical cancer, refer the client to a family planning clinic. I'm sorry, I couldn't help myself about the Maury stuff, because you already know the TikTok algorithm be feeding me Maury stuff, because, you know, I miss it. I miss it. But shout out to all 230 of y'all in here rocking with us. All right, what are we thinking? All right, what y'all got? Camille, look, Camille, you and I are going to have a conversation, all right? Is it Kismet? Appreciate the follow. Ashley, appreciate the follow. Taylor, appreciate the follow. All right, y'all, here we go. Here we go. Here's our answer in 3, 2. And our answer is A. Counsel the woman to consent to HIV screening. The client's behavior places her at high risk for HIV. Testing is the first step. If the woman is HIV positive, the earlier treatment begins, the better the outcome. What? I know. Yeah, my first answer was correct. So what did I tell y'all? What did I tell y'all about changing your answers? Oh yeah, consent, duh. Shouldn't she already have been tested? So let's see what it is. So the first 3 months, so what that puts her at 12 weeks, right? Some people, so essentially this is like her first appointment, right? That's what we can assume. But then again, assuming does what, right? So 3 months, her first pregnancy, first appointment, right? Hey, D was the next intervention, so I was close. Hey, so being close won't get you a pass, Camille, huh? I looked over the keywords. Daniela, you got to look over the keywords, all right? You got to look over those keywords, right? And Camille, you look, I'm about to give you a 600 just because you said that. All right, here we go. It says, when taking the NCLEX, all the answers can be right as to which one is most right. Let them know, Gina. Let them know out here. It's me, Jackie. Appreciate the follow. I know I'm just trying to make myself feel better. Look, all right now. All right, here we go. Question number 34. A 16-month-old child has just been admitted to the hospital. As the nurse assigned to this child enters the hospital room for the first time, the toddler runs to the mother, clings to her, and begins to cry. What would be the initial action by the nurse? Arrange to change client care assignment, explain that this behavior is expected, discuss the appropriate use of timeout, explain that the child needs extra attention. Let me just tell you right now, I'll put anybody in fucking timeout. I don't care who kids they are. All right, so we got B. We got B's, okay. What else we thinking? We got B. Kurt says B. Okay. Kurt said B, y'all. Y'all already know the deal. All right. 15 more seconds. Who says B? It's Denny. Is it Daisha? Daisha. Appreciate the follow. All right. Paul, thank you for the share. B, appropriate for age. I mean, because they're 16 months. I'm telling you right now, my son is 18 months and he just be running to, me and his mom just because. Angela, thank you for the follow. Here we go. Answer in 3, 2. And the answer is B. Explain that this behavior is expected. During normal development, fear of strangers becomes prominent beginning around 6 to 8 months. Such behaviors include clinging to parents, crying, and turning away from strangers. These fears/behaviors extend into toddler period and may persist into preschool. That's right. So you got these little toddlers out here, these little 16 month, 18 month, all the way up to 3, 4 years old before they go up to school. I'm gonna tell you, holding on to your leg and you're walking with them, they might as well just be like a leg warmer. Psychosocial integrity, y'all. Psychosocial integrity. All right, on to the next. Question number 35. While planning care for a 2-year-old hospitalized child, which situation would the nurse expect to most likely affect the behavior? Strange bed and surroundings, separation from parents, persistence of other toddlers, or unfamiliar toys and games. We got B's. Okay. Tabitha says B. Maria says B. Is it Rude Gale? B. Selena says B. Salinas says B. I'm sorry. I didn't mean to do that. Larissa shared. Appreciate you. B. Although all of them may contribute. Okay. A. Never said what? Never said parents what? Never said parents are present. Don't read into the question. A. Uninterrupted routine. Okay. I think it's B. All right, Miss Butterfly. Anything for Salinas. No, you didn't. And you hear it come out of me? I can't stand you, Camille. I cannot. All right, here we go. Here we go, y'all. All right, here's our answer in 3, 2. And the answer is B. Separation from parents. Separation anxiety is most evident from 6 months to 30 months of age. It is the greatest stress imposed on a toddler by hospitalization. If separation is avoided, young children have a tremendous capacity to withstand other stress. Got it. The person that said A read into the question. Let's see. It says, okay, so here was A. Most children, even school-age children, are fearful of strange bed and new surroundings. Look, I'm a grown-ass man, and if I'm in a hotel, I'll wake up and be like, yo, how the fuck did I get here? That'll scare the largest adult. So I'm just saying. If the answer, if it's an answer, it's an option. That's true. It's true. All right, here we go, y'all. Here we go. Hey, we're doing NCLEX questions. Here's our other break. Hey, participate. That's what y'all do. I'm kind of funny. That's what I do. Give me all the likes. That's what y'all do. I'll give you more questions. That's what I do. Give me all them likes. Don't troll my chat. I don't want you to do that. However, I will give you a 600 if you decide to act up in my chat. Nurselabs.com is where I got the questions. Go over there and check those out for yourself. Of course, the Nursing School Summit. Go over there and register. The link is in my bio. 7-day NCLEX course. Pre-launch phase, $48. I'm telling you, it's gonna be a game changer once it's all finished. And of course, thebootnurse.com. All right, here we go. Question. Fingers. I forgot, Sandy. I forgot that I haven't given nobody the finger today. So fingers. All right, here we go. Question 36. While explaining an illness to a 10-year-old, what should the nurse keep in mind about the cognitive development at this age? They are able to make simple associations of ideas. They're able to think logically in organizing facts. Interpretation of events originates from their own perspective. Conclusions are based on previous experiences. We got A, we got D. User 70 says A with a question mark. Hair by 3T says B. Okay. All All right, Autumn says D. It's me, Jackie says D. Okay. Anytime I hear the word Jackie, it just reminds me of that 70s show. So if I start making quotes from that show, minus whatever just happened with the home dude, I may do it. I'm just letting you know. All right. So here we go, y'all. 10 more seconds. 10 more seconds. All right. Allison says A. All right. Evan says A. Maria says C. All right. Here we go, y'all. Here we go. Here's our answer. Brittany, thank you for the follow. Here we go. In 3, 2, and the answer is B. They are able to think logically and organizing facts. The child in the concrete operational stage, right? According to Page, is it Pageant? I always messed up that. Is capable of mature thought when allowed to manipulate and organize objects. I don't believe that. I don't like that one. I don't like this question. That can't be right. And I'm going to let you guys know, when you guys are taking NCLEX, you guys are going to find those questions. It doesn't matter what test bank that you buy. I'm just going to be giving you guys the complete Piaget. There you go. There you go. So here's the thing. You are going to come across questions that are terrible. They're going to come across terrible, and you're not going to agree, right? But out of the 1,000 questions that you go through, you'll probably have, less than 100 that'll either be omitted, that don't make sense. Don't argue with it. Right? Don't argue with it, because you will just hurt your own mental capacity. What in the world? I know. I don't agree with that one. That one I would omit. I don't like that one. I don't like that one at all. Piaget, yeah. Piaget. I don't like. I always mess it up. Anyways, question 37. The nurse has just admitted a client with severe depression. From which focus should the nurse identify a priority nursing diagnosis? Is it nutrition, elimination, activity, or safety? It's D. You got D's. It's D's. Safeties. It's D's. Okay. It's D's. Nothing but D's. Mental health is always patient safety. Look at that. Look at that. Hey, if you guys are just now joining us, we're doing nursing NCLEX style questions. My name is Kevin. I go by the Boot Nurse. Check me out on all those social media platforms. Everything is at the Boot Nurse. All right. I want to know who you are, where you're from, where you're at in your nursing journey. Let us know down in the comments, right, while you guys participate and answer the questions. But here is our answer. Appreciate the follows. Here's our answer in 3, 2, and then the answer is safety. Safety is a priority of care for the depressed client. Precautions to prevent suicide must be a part of the plan. Depression can be effectively treated in primary care settings using an evidence-based collaborative approach in which primary care providers are systematically supported by mental health providers in caring for a caseload of patients. Waiting to write NCLEX. Ooh, you must not be in the United States, because only people outside the United States say write. I got you though. I got you. I understand. Get ready to take that exam. Get ready. I just failed for the 3rd time. I failed my NCLEX 3 times, y'all. I failed my NCLEX 3 times. So my question is, for everybody that was unsuccessful at the exam, what are you about to do about it? What are you going to do about it? Take my NCLEX in 2 weeks? Yeah, Daniela, you told us that. I remember. Right, still waiting for approval using the reverse learning technique. Shout out to you. All right, shout out to you. 2nd year as an OR nurse. Hey, shout out to my OR nurses. That's where I work, as an OR nurse. All right. Here we go. Question number 38. Which playroom activity should the nurse organize for a small group of 7-year-old hospitalized children? Is it sports and games with rules, finger paints and water play, dress up clothes and props, or chess and television programs? You're so discouraged. All right, but you're discouraged. But what are you going to do to fix it? Remember, everything in life is your fault. So my question is, well, how are you going to fix it? And even if it's not your fault, and what you going to do to fix it? You see the dramatic pause there? You see look, I don't coddle. I am very understanding, but I'm going to tell you right now, the same feelings that you went through and the same things that you expressed is the same thing that I've expressed. And I too can have conquered that exam just like many other people, right? All right. So here we go. We got B, we got A, D, C. You guys are all over the place. All right. All right. 10 more seconds, y'all. 10 more seconds. I'm tired. Look, I know it. But how bad do you really want it? How bad do you really want to be in this shit show? Think about it like that. Definitely A. Okay. All right, here we go. Here's our answer in 3, 2. And the answer is A, sports and games with rules. The purpose of play for the 7-year-old is cooperation. Rules are very important. Logical reasoning and social skills are developed through play. Definitely a shit show. Gary, you already know what the deal is. Katie, thank you for the follow. I don't know, seems good for the hospital. Yeah. So you got to think of like which one is more right. User92, I appreciate the follow. Thank you. Thank you. A seems dangerous. Depends on the sport, right? 7-year-olds playing basketball. I mean, you have children that can be in the hospital that can go outside, or they can play, whatever other type of games, So here's our next question, question number 39. A client is discharged following hospitalization of congestive heart failure. The nurse teaching the family suggests they encourage the client to rest frequently in which of the following positions? Is it high Fowlers, supine, left lateral, or low Fowlers? As we answer this question, I want all 311 y'all to understand this. Do you guys think that this is a passing level question on NCLEX? I really want to know the input. I really want y'all to let me know. You guys say no. Why? Why is it no? What type of question is this to make it a no? My screen is black. That seems a little racist. I'm just playing. No, it's easy. Too easy. CNA. Okay. So I don't know these terms. So A. Okay. All right. Because it's memorization. You are very correct. It's a memorization type of question. Just know you can get memorization questions on your NCLEX. However, if you're getting a memorization question, you might as well just slow down and take a breath and realize to yourself that you are not meeting the minimum standard of analysis and application when it comes to answering. There you go. No application when it comes to answering NCLEX style questions. Right? Because analysis and application allows for you to use clinical judgment and critical thinking, right? And so the answer is high Fowler, right? Sitting in a chair or resting in a high Fowler position decreases cardiac workload and facilitates breathing. Fundamentals is hard for me. I always get stuck with 2 good answers. You're right. So now you got to figure out which one is more correct. If you're getting this question on NCLEX, you're in trouble, 100%. And I can tell you from personal experience, when I took my NCLEX for the second time, I got a question where it was just like, hey, you have a patient who has, something. What do you think it is? And I was just like, and I had to stop, and I was just like, yo, I am not doing well. I am not doing well at all. So think about that. So if you get this question on NCLEX, most likely you're going to fail. That's not what I said. I said if you're getting questions that are this easy, you are not meeting the minimum standard. You could get, the test will give you, you'll get the minimum amount of questions. Let's say you got to question 40 and then you were getting easy questions like this, right? You have another 45 questions to get it together. Okay? So here we go. Question 40. The nurse is caring for a 10-year-old on admission to the burn unit. Shout out to the burn unit. I used to work there at one point. One assessment parameter that will indicate that the child has adequate fluid replacement is what? Urinary output, 30 mLs per hour, no complaints of thirst, increased hematocrit, good skin turgor around the burn. Somebody said, and I didn't fail. I didn't see a word that you said. I'm sorry. All right, I'm going to give you guys 20 seconds, 20 more seconds. Another memorization question. Some A's. Hey, and just a quick shout out for anybody that is inside of the 7-day NCLEX course. I'm going to start doing I'm going to start doing NCLEX questions also inside of that group. So that's another special thing that I'm going to be doing with those people that jump in over there too. And they're not going to be from here. They're not going to be from nurse.org or nurselabs.org. They're going to be the ones that I created, and they're going to be from other sources that are out there. So if you're a part of that, be looking out for that. That email is going to be coming out. All right. So here we go. Here's our answer. any NGN yet in your program? Working on that. Working on that. Working on that. All right, here we go. Here's our answer. Our answer is A, urinary output of 20 mLs per hour. For a child at this age, this is adequate output, yet does not suggest overload. Disruption of the sodium, the ATPase activity presumably causes intracellular sodium shift, which contributes to hypovolemia and cellular edema. Heat injuries also initiate the release of inflammatory and vasoactive mediators. These mediators are responsible for local vasoconstriction, systemic vasodilation, and increased transcapillary permeability. Increased transcapillary permeability results in a rapid transfer of water, inorganic solutes, and plasma proteins between the intravascular and interstitial spaces. Boy, let me tell you, that was a mouthful. What position do we put in for shock? Y'all give him that answer. What position do we put a patient in for shock? We'll say hypovolemic shock. What position do we put him in? I have to go to work. Y'all have a good night. Burnt out mom. Appreciate you being here. Your minimum is 30 an output left. Okay. If they're in hypovolemic shock, what do you want to put them in? T-Berg? Reverse T-Berg? High Fowlers? All right, hey, so we got physiological adaptation. We got supine, semi-Fowlers. Supine? No, I wouldn't say supine. U-World says supine? Trendelenburg. Okay. All right, here we go. No, definitely not prone. Who said that? Prone? Ma'am, absolutely not. All right, here we go. Hey, doing NCLEX question. Shout out to all 200 plus of y'all in here. Participate. Gifts. No trolling. Nurselabs.com. Go over there and check out their questions. Don't forget about the Nursing School Summit presented by Pick, Monic, and True Learn that I'm doing. Link in the bio. 7-day NCLEX course. $48 in the pre-launch phase. Also link in the bio and thebootnurse.com. All right, here we go. Appreciate the share. Here we go. Question number 41. What is the priority nursing diagnosis for a patient experiencing a migraine headache? Right? Acute pain related to biologic and chemical factors, anxiety related to change in or threat to health status, hopelessness related to deteriorating physiological condition, or is it risk for side effects related to medical therapy? All right. All right, y'all. I'm going to give y'all 25 seconds. Okay, we got A's. All right, here we go. Here we go. Somebody asked me a question. Did somebody ask about the hypovolemic shock? It's Trendelenburg. T-Berg. All right, here we go. Here we go, y'all. Here we go. Here's our answer. Here is our answer. Scorpio Princess. I didn't even see you come here either. You over here surprising me. Wes, appreciate the follows. Here we go. In 3, 2, Brittany, thank you for the follow. All right, the answer is A, acute pain related to biologic and chemical factors. The priority for interdisciplinary care for the client experiencing a migraine headache is pain management. Pain management. Yeah, I thought it was. I thought you started 15 minutes later. What? What you mean? I forget something? Classy Queen, ma'am. I appreciate the follow. Thank you. Thank you. Thank you. Thank you. Physiological adaptation. That is a part of what? I mean, not a part of what, but that is the what section. What largest section on NCLEX? All right. 5:30 Central Standard Time. Yeah, I did that. I did that. Any helpful tips for LPN pharmacology? Not sure if it's different. So there's nothing necessarily different about pharmacology. When it comes to learning pharmacology, either it be the LPN and RN, it is exactly the same. However, there are things that you cannot do as an RN on a national level. Like you can't give IV medications, you can't do blood products, right? Those are the things that you can't do. Pharmacology doesn't change. Let them know. Let them know, right? So here we go. Question 42. You are creating a teaching plan for a patient with newly diagnosed migraine headaches. Which key items should be included in the teaching? Select all that apply. Avoid foods that contain tyramine, such as alcohol and aged cheeses. Avoid drugs such as tegamet, nitroglycerin, and nifedipine. Nifedipine. Abortive therapy is aimed at eliminating the pain during the aurora. The potential side effect of medications is rebound headache. Complementary therapies such as relaxation may be helpful, and continue taking estrogen as prescribed by your physician. But yeah, to answer your question about LPN, or to reiterate your question about LPN pharmacology and RN pharmacology, they really are the same thing when you're learning, right? And LPN, you're right, LPN and LVN, it's the same thing. It's just that the name just changed depending on the state. Like if you're in New York, it's LPN. If you're in California or Texas, they're LVNs, right? But it's the same position. Why it's like that? I don't know. I don't know why. Okay, thank you. I'm having trouble studying for it and passing the test. Okay, yeah, no problem. All right, y'all. 10 seconds. Is it Wavy Tay? Appreciate the follow. All right, here we go, y'all. In 3, 2, 1. A, B, C, D, and E. No F. No F. The client should be counseled on the food and drugs that are allowed. You should also be educated on the side effects of the medications given. Methods of distraction for pain should also be included in the teaching plan. I would have selected all. Yeah, you would have selected one more than you should have selected. But nowadays, you would have got that question. If the question was worth, what, 1 point? What is this? 1, 2, 3, 4, 5, 6. They would have divided that up by like what? 0.2 something or 0.15, and you would have got like the majority of those points, right? Me with migraines. Hey, I'm just saying, these migraines, they be taking you out. I would have come out with a W. That's what I'm talking about. All right, here we go. Question 43. The patient with migraine headaches has a seizure. After the seizure, which action can you delegate to the nursing assistant? Document the seizure, perform neurological checks, take the patient's vitals, restrain the patient for protection. I can't take extra estrogen with the migraines. Is that what you said? Because of my migraines. Oh, I got you, Whitney. I see what you said. All right, we got C's. We got C's. We got C's. Okay. All right. Okay. Cassidy says D. Or did you say D or C? Or did I read that wrong because I'm dyslexic? You said C. My bad. Don't come for me, Cassidy. All right. Classy Queen says C. Kel says B. Or Khalees, I'm sorry, says B. Pooh says A. Whitney says never D. Okay. All right, here we go. 10 more seconds. Let me see what you guys got. Shout out to all 300 of y'all up in here. Brittany says C. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. All right. I want to know. Prereqs, nursing school, already graduated, taken NCLEX, failed NCLEX, been a nurse for a while. Let me know. Only if you're new here. Only if you want to. All right, here's our answer. It's C. Take the patient's vital signs. And that is a management of care question, right? Management of care. Lucy, thank you for the follow. Appreciate the follow. Thank you. Right, management of care. The largest section on NCLEX. All right. Taking vital signs within the education and scope of practice for the nursing assistant. They can do that. They can definitely do that. However, when it comes to somebody who has had, done a seizure, they can take vital signs, but it's the RN's responsibility to take the very first one, right? Grad, need to take NCLEX practicing LPN. Shout out to you, Rose. Shout out to you studying for NCLEX. Okay. All right. Shout out to y'all. All right. And make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. I need y'all to just pretend to like me, but just don't ever unfollow me. You know what I'm saying? I may post some funny stuff out there to get people all pissed off and stuff. You know what I'm saying? But that's how I go. So, all right, here we go. Question 44. You are preparing to admit a patient with a seizure disorder. Which of the following action can you delegate to the LPN, LVN? Complete admission assessment, set up oxygen and suction equipment, place a padded tongue blade at the bedside, or pad the side rails before taking before the patient arrives. Howie says, I've been an RN for 16 years in California, and this is hella fun. So thank you. You're welcome, Howie. We got D's all around. Two Shoes says B. Okay. Brett says D. Mary says D. Okay. Okay. All right. NCLEX, so easy. Depends. It's not so easy for most. If it was so easy, everybody would pass it. Nursing school, okay. Shout out to all 297 of y'all. Smash that like button. No intention to go into medicine, but learning is so interesting. Hey, is that Calliope? Is that it said? Calliope? Shout out to you, Calliope. It's always good to learn a little something different, right? Ain't nothing wrong with that. Stars, appreciate the follow. Nursing school, second semester. Eli, okay. You can only give me one user 84. What are we doing? This ain't select all that apply. Come on now. Pooh says B. It's not easy because it finds what you don't know and keep. Yeah, facts. Why not C? Well, we'll find out when the rationale gets here. BSN last semester. All right. Dietitian over here, but love learning about nursing. Shout out to you. Here we go, y'all. Here we go. Here's our answer for question 44 in 3, 2. And the answer is B. Set up oxygen and suction equipment. They can do that. And somebody said, why not D? Padded side rails are controversial in terms and of whether they actually provide safety and may embarrass the patient and family. I don't know. These are, to me, these are very easy questions. These are questions that essentially that you would get in nursing school, like even on a quiz. You know, although it does fall under the management of care section. All right. Somebody said not C. Hey, thank you for the follow. Not C because you can't put anything in the patient's mouth. Facts. We always pad the beds. We always pad the beds for those patients. Yes, we do. 100%. I've had patients seize on me when they're seizure. When I worked in a neuro ICU, because I floated between both medical and neuro, and anybody that was on seizure precautions got that. It was the hospital's. It was the facility's protocol, right? All right, here we go. Here we go. Here we go. A nursing student, well, like some of y'all that are in here, is teaching a patient and family about epilepsy prior to the patient's discharge. For which statement should you intervene, right? And it's essentially saying, you as the nurse, what statement should you intervene? You should avoid consumption of all forms of alcohol. Wear your medical bracelet or your medical alert bracelet at all times. Protect your loved one's airway during seizure. It's okay to take over-the-counter medications. What are we thinking? What are we thinking? What are we thinking? Shout out to all of y'all that are in nursing school right now. When you guys go to clinicals, this will be you guys and gals. All right, explaining things to the patients. Get very comfortable doing that. Get very comfortable, talking to your patients. You got to get comfortable doing that as well as conversing with the doctors, no matter how much of an asshole they are. Howie says C. Hey, Howie says C, y'all, so we're already done. I'm just playing. You're not a doctor. You can't authorize over-the-counter meds. That's true. RN here. It's interesting looking back. Ain't it though? Ain't it though? Ain't it though? Yes, you are looking for the wrong question, right? This is why it's important. This is why I say RTFQ, right? RTFQ. Read the expletive word question. That's the thing. I've only worked in labor and delivery, so some of these I don't know. And that's okay, because here's the thing. There's a newsflash to all the students that are out there. You as a nurse are not going to know everything, right? I have never worked in labor and delivery, and I would be, look, don't you even think about it. Don't even think about it. Don't think about putting me there, right? Don't you ever do it. That's just like me grabbing somebody from med-surg and be like, hey, go be an OR nurse. Good luck. Good luck to you. I read the question wrong. I was going to say C, but it's definitely D. Look at that. See what happens when you RTFQ? There you go. All right. And that's what I have to try to tell people all the time. All right. You say D? All right, cool. Here we go. Here's our answer, y'all. Here's our answer in 3, 2, and the answer is D. It's okay to take over-the-counter medication. That is the wrong thing to do. And this is where we intervene with our students saying, hey. That's not what we say. I mean, then we go on about our business. A patient with seizure disorder should not take over-the-counter medication without consulting the physician first. It is not okay. Whoop, whoop. Shout out to y'all. Shout out to y'all. Hey, in that category, it's part of health promotions and maintenance. Remember, the NCLEX makes up The client needs is 8 sections, right? What are the top 3? What are the top 3? Appreciate the follows. You read it wrong. There you go. You did read it wrong. That's why I say RTFQs. Like, what are they truly asking you, right? That's why you have to read that. There are trigger words. What is RTFQ? Man, I wish Avery was here because I need Avery to tell y'all. RTFQ. Read the expletive word question. All right. Read the full question, frickin' question, effing question. I like saying the F word. It's probably a nurse's favorite word. Also, I'm in the military, so my favorite word is the F word. But, you know, I have to kind of chill out because I have an 18-month-old, and my dude is going to start repeating stuff, and then I'm going to be laughing, but then I'm going to be real embarrassed if he go in front of somebody start dropping the F-bomb. All right? Hey, and ladies and gentlemen, we are done with questions. Now we're going to jump into, like that Ask Me Anything type of questions or, whatever. I'll do that for like another half hour. But thanks. I appreciate everybody for participating. I appreciate everybody hanging out. You guys don't know how much this really means to me that you guys decided you guys want to do this. So I really appreciate it. Nobody got banned today because I am petty over 9,000. So you come over here and act a fool, I'm going to get rid of you. Nurselabs.com is where I got the questions. Don't forget about the summit, the NCLEX, the 7-day NCLEX course, as well as the bootnurse.com. Okay, so as we'll move on to the next segment of this destructiveness. What's up, y'all? How y'all doing? How y'all doing? See you Monday, Miss Chronicle or Miss Coco Chronicles. Okay, what's today? Today is Friday. We're gonna be doing this on Monday, same time. Scrub Tech here. What did you struggle with translating to the OR, thinking about circulating? Well, I was a scrub tech. I think we already talked about that before. My biggest thing translating to is the level of responsibility, and it's going to change depending on what hospital you work at. Because I don't know what hospital that you work at, and I don't know what level of responsibilities that, 5:30. Is it Angelica? I think I said that right. I'm sorry. But yeah, what time do you start? I said 5:30. 5:30. It should be on my bio. If it's not, I'll have to just put it up on there. All right. Can you teach how to prioritize? I mean, I can't really teach you how to prioritize now. I do one-on-one coaching, by the way, y'all, if y'all want to know anything about that. And somebody in here asked me what my son's name was, and my son's name is the same as mine. So are you civilian nurse or military? I am a civilian nurse, but I am a military surgical tech. So what time zone? Central Standard Time. Central Standard Time. As a matter of fact, anybody that wants to know when I go live, make sure you guys hit the notification bell on my bio, so it'll let you know when I'm doing it. What disease process do we use hypertonic saline? I don't know. Tell me. You tell me. What did you scrub? I mostly scrubbed general and GYN when I was a scrub tech, and now ironically, like when I circulate and when I did scrub, even as a nurse, it was general and GYN. So. What's the summit thing? So the nursing school summit is essentially, a bunch of us nurses getting on a live stream with Picmonic and True Learn, just giving out, one of the top things that nursing students want to know in regards to, nursing school, NCLEX, clinicals, all that good stuff. I have difficulty choosing the right answers. Okay. Can you please bring psychiatric questions? You know what? I can look at that. I'm a military nurse. Shout out to you, is it Felicity? So I've worked with nothing but military nurses, obviously, my entire career. I'm a hospital corpsman. I've been in the Navy for, as a matter of fact, yesterday. Here, let me see. I'm sorry. On the 27th, it was 16 years. So I'm currently awaiting a commissioning package, but we'll see how that goes, So, great. Thank you. We'll look into it. Also, like I said, if you guys want to look into that nursing summit, that link is in my bio. In my link tree, it's the very top one, and it's free to register. Good night. See you Monday. See you Monday. Regina, appreciate the share. Thank you. Appreciate all the likes. You guys got me to 15K. I really appreciate y'all. The more that you guys like, the more that it gets out there. All right. Now, what questions do you guys have? Let me know. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Let's talk about it. I failed pharm final. I have to retake the class. I'm heartbroken, feeling so defeated. Kari, we talked about this before, I thought, right? So what I would recommend is knowing we already talked about, family name, suffix, where do they fall under? What are their normal signs and symptoms, right? What are their normal signs and symptoms that you're going to be looking for? And then also the suffix of the
of their actual name. Like LOLs, beta blockers. Okay, what do? They decrease heart rate and they decrease blood pressure. What are you going to be looking at from a safety perspective, right? So that's how you have to think of those. Through the whole process of becoming a nurse, what was the most difficult part in your opinion? The time management, because nursing school expects for you to stop everything that you're doing in your life to just dedicate it to them. But it's hard to do that when you have a family, or if you're married, or if you have children and anything. And then the biggest thing that happens at the beginning of nursing school is that people get divorced. They didn't realize what they were getting themselves into. They weren't prepared for it, so on and so forth. Time management, having a good support system, accountability. But time management is by far probably the most important thing that I had to adjust to. Do you have any tips for high schoolers trying to get into nursing school other than dual enrollment? If you're trying to go to nursing school, you have to do the prereqs. And if you're doing that like dual enrollment, like you're in college and in high school at the same time, start knocking out the classes that will get you to nursing school faster, such as A&P 1 and 2, micro, chemistry, nutrition, sociology, human growth and development, all those nursing prerequisite classes. That's what I would recommend if you're dual enrolled like that as a high schooler. Do you do one-on-one review for NCLEX? Yes, I do. If you go to my link in my link tree, it'll say NCLEX Coaching and Mentoring. It'll be in there. I'm an overthinker. It got me. So I would recommend to you, Kari, is you getting practice questions for pharmacology. And you may need flashcards. Or you may need to go through the questions and get through the anxiety. You have to put yourself in a practical position to be able to practice like what it's going to look like when you take your exam. Miami, I graduated in March, took the NCLEX twice, going in for the third attempt, hoping to get it. Helen, we don't say hoping. We speak things into existence in here. I'm a very big proponent of putting things out into the universe and then getting it back. All right. So you'll be like, hey, I'm going for my third time. I'm going to rock that fucking test. And that's what we're about. OK. Nursing school equals life. Nothing else matters. That's facts. Nothing but facts. I was a corpsman and got out, and now I'm halfway through a nursing school. Shout out to you, Andy. Shout out to you. I went to nursing school while I was on active duty. So I was full-time. I was a full-time in active duty. I was also a surge tech instructor while I was a nursing student. Like I said, time management. Some people can do it. Some people can't. All right. So you just got to figure out how to do it for your life. Do you recommend going officer or civilian nurse in hospital and military hospitals? Andy, it all just depends on you. It all just depends on you. You could go and be a civilian. You could be a civilian nurse and then be a reserve Navy officer and be there as well, But I mean, they all have their they both have their benefits. It just depends on what you want. Clinical math. Yep. I'm terrified to take it in 2 weeks. Don't be terrified. You want to know why? Because if you're terrified, you're denying the inevitable and you're letting an exam that has no feeling or comprehension of anything in life, like an AI, beat you, somebody who has an emotion, in order for you to conquer that exam. So don't let it beat you and don't be terrified. And the thing about it is that if you prepare correctly, that test is not going to do anything different to you that it hasn't done to anybody else. That's for you, Maria. Okay. Helen says facts. You're welcome, Helen. Starting my ABSN program in January. Is it Markel? Shout out to you, sir. I know it's different everywhere, but I've seen people say prereq A&P and micro is hard. Anything can be hard if you don't apply yourself to it. I actually liked micro. I didn't mind A&P. I thought A&P was easy, and it's because I had already been a corpsman in the Navy for a while anyway. I don't like chemistry. Did not like that class, like at all. Like my math don't be mathing, and nope. However, so chemistry was a hard one for me. But what I would recommend is that if those classes are hard, take that one class by itself. Take that one class by itself. Like when I did chemistry, that was the only class I took that semester. I'm taking micro right now and I'm struggling. It'd be like that. I would definitely check out, if I remember right, I think PicMonic actually has like really good breakdowns of micro. You can go and check them out. Link is in my link tree as well if that's something that you're interested in. If you use my link, you get 20% off. Just letting you know that right now. So thank you. I'm still thinking. I'm still in reserves right now, so I can get my points for retirement. Shout out to you. That's exactly what I'm doing. Micro was my favorite class. I enjoyed it. Like I said, for me, I enjoyed micro a lot. I graduated in December. Any good resource recommendations for NCLEX prep? Well, Mr. Ghost. Wait, when did you say you're taking you graduated in December? Okay. So, of course, I'm always going to recommend my course, the 7-day NCLEX course, but it's in its pre-launch phase right now, so it's not complete. But it's for $48, and the majority of it will be done around Black Friday. So, you could jump into that and be an early adopter of that. But then, of course, you got Archer, you have UWorld, you have Kaplan, you have Remar, you have Mark Klimek, Simple Nursing, you have NCLEX High Yield. I think, oh my God, what's her name? It's Registered Nurse RN, Nurse Sarah. I know that she has one. So it all just depends. Those are the recommendations that I would give. And it all just depends on you and, what you like and what you can afford. Chem was so tough for me. And look, chemistry is a monster. Is it Gizmo says, I'm a CST currently trying to transfer to RN. Cool. Okay. Shout out to my surge techs that are out there. Shout out to y'all. You're going to make it work. Jason out there smashing that like button. I appreciate you, sir. How can I go about retaining information? And it's getting harder to get the concepts, and I'm in OBPs. All right, beautiful. I'm going to tell your beautiful soul. I'm going to let you know right now. So if you that's telling me that you're still in school right now. OK, so what I would recommend is if you're in OBPs right now, I would recommend getting into a small group. And if you're not already, be in a small group of 4 people to include yourself. So you and 3 other people. And then whatever exam that you guys are studying for right now, break it up into quarters. Like you do 25%, somebody else does 25%, so on and so forth. Once you do that, put it all together. That way, like, hey, I've taken relevant notes. It's like you're a part of that group, and that you're a part of that group mentality, bringing it together. So now you can go through notes together and then study with one another and then hold each other accountable. Don't be talking about fucking Taylor Swift and Travis Kelce. Don't be talking about that stupid shit. Keep it, keep it all the way 100 about what you're doing. Right. And so that, number one, will alleviate the amount of time you have to focus on the entire section. But then, you guys can quiz one another going back and forth. OK, Nurse Sarah and Mark Klimek helped me out a lot. Mark Klimek is the guy, straight up. UWorld and NCLEX High Yield are awesome, but it all depends on how you learn. Thank you, Helen. Thank you for saying that. Please answer the watcher. What did you ask me? I love Taylor Swift. Oh. Don't nobody care about Taylor Swift. Sorry. You know what I care about? NSYNC and them going on tour. Yep, I'm that dude. All right. Hey, don't judge me, okay? Scorpio Princess, see you Monday. Thank you. You're welcome. Melissa said, thank you for all your help. I passed. Melissa, that's what I'm talking about. Hey, y'all give Melissa all of her flowers right now. She passed. That's what I'm talking about. Welcome to the greatest shit show that you'll ever be a part of. But hey, congratulations to you. Your hard work paid off. I'm extremely proud of you, even though I have never met you in person. And if I did meet you in person, I would tell you the same exact thing. So welcome. Congratulations to you. Now you can kind of breathe a little sigh of relief before you go and get your job. And then shit really hits the fan. So then you'll have whole other problems to deal with. And that's a part of the process that we go through. OK, so don't you even sweat that. Who is that? Goober Med. Your name is Goober Med. I was like, man, I know my man's name is not Goober Med, but thank you for your info, man. Yeah, hey, look, man, I don't gatekeep. There's no need to gatekeep at all. Like the information's out here. It's just all about how you use it and how you apply it. And I like doing these lives to give them to people straight up. All right. So, hey, shout out to all 72, 74, 76 of y'all rocking in here with me. My name is Kevin. I go by the Boot Nurse. I want to know who you are, where you're from, where you're at in your nursing journey. We did NCLEX questions. Now we're essentially doing an Ask Me Anything type deal. If you missed the questions, this video will go up on YouTube. Make sure you guys go over there and check that out. Oh snap! Hey, look, hey, who sent me that? Melissa? Okay, girl, thank you. I appreciate it. Gizmo, hey, I appreciate you. Hey, y'all could have, everybody that was in here, y'all could have been anywhere else, but y'all decided to be here with me on a Friday so y'all can get y'all's learn on. Is there any way I can get in touch with you privately? Yeah, you can send me a message. Melissa says, how do you feel about home health nursing? Love it. I love it for you. Jason Derulo. Really? You think I don't know that? He looks like me, by the way, because I'm older than him. I'm just letting you know that right now, okay? Home health nursing, it's good. I think like I've never personally done home health, but I do have friends that do home health and they love it, and they're never looking back, going back to bedside or going back to anybody's hospital system. What kind of nurse are you? Right now, broke boy Mel, I am an OR nurse. I worked a little over a year in the ICU, spread out over 3 ICUs. Then I spent a few weeks or a few months in a PACU, and then the rest of my time has been as an OR nurse. So, Markel, sir, appreciate you. Thank you for the follow. But yeah, I heard that OR is chill. So OR is chill. It can get pretty hectic depending on the doctor and what service that you work in. So most chill doctors that I've worked with are the general surgeon, like the general surgery realm. And as a civilian, it was ortho. But general surgery is chill. I mean, you get one patient at a time. There's going to be a minimum of 4 people in that room all at once. So it's you as a nurse, the surgeon, the surg tech, and anesthesia, So, but the OR is not for the weak, right? Because you have a lot of responsibility. Things go really fast. And the biggest thing that you need to know about working in the OR are your times. If you don't have your times down, it'll mess up everything. And I'm telling you, if there's one thing you'll get yelled at about as an OR nurse, it is your times. Are you going back to get a MSN, or are you currently in MP school? Why does everybody think I'm in MP school? I am going back to get my MSN. I've done primary care for 20 years as an LPN. I'm looking forward to utilizing my skills. Do it. Home health. Do it. I think you're going to love it. Times. Okay, so Rebecca's asking about time. So we have what we call timestamps in the operating room. So because it's all about productivity. Not only is it's all about productivity, but it's all about exposure to medications, infection times, so on and so forth. So when we roll our patient into the room, we do what we call an in time, or an in the room patient time. We need to know what time they get in there, because then that's when it talks about starting the anesthesia. And then we have an anesthesia start time when they start intubating their patient, as well as we have prep times, because it's all about timing. It's all about timing in the operating room. If you don't have the timing, too much medication, bad thing. Too long exposure of an open abdomen out here in the atmosphere, bad thing. Okay. That's why times are super important. So you want to be an NP? No, I do not want to be an NP. I want to get my master's in education, efficiency, work together, facts. I miss prepping patients. That's all right. I've prepped patients for a long time as a tech. And then when I did as a nurse, I'm like, oh, okay. So I'm doing my MSN and I'm studying for NCLEX. I wanted to get ahead of it. Oh, okay. I got you. What are you getting your MSN in? Are you in a direct MSN program? I'm assuming, Maria. I really like psych unit, but nurses lose their skills in psych. I'm going to tell you like this. Who was that? Broke boy Mel. Go to where you want. Like people are talking about, like, I'm going to lose my skills as a nurse. Okay. And you're going to lose your skills as a nurse. You do the same thing will happen to you if you go and work, do administrative work, but you do it as a nurse, right? Same thing's going to happen to you if you go to the OR. You'll lose the basic skills of, what it's like to be the basic type of skills that you get as a nurse when you're like in school or like in med surg. That's okay. If you want to go work psych because you have the ambition to go be a psych nurse practitioner, go do it. Do not pass go. That's like saying, hey, I'm going to go be a CRNA, but I'm going to lose, my basic skills. I mean, even though they don't, because, they have to know everything. So if you want to go do psych, bro, go do psych. Don't let these people out here running their mouths saying you're going to lose your skill. Don't nobody fucking they don't give a fuck about you. They don't give a fuck about that. Go to where you want to go, big dog. You good out here. I'm doing online at Chamberlain. Okay. Oh, so you're doing your BSN. Okay, I got you. One of my friends, she got her BSN or she got her associate's through Chamberlain, I think, and is getting her BSN in Chamberlain right now. So thank you, brother. I appreciate the insight. Yeah, man. I'm all about the insight. Here's the thing. I love nursing as a whole, like, because there's so many things, like I call it the spider web effect. You can go here, 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 and here. However, the thought process of where people say that you need to stay bedside, keep your skills, fucking get a hunchback by working 40 fucking years of fucking bed. Like, none, those days are over. Those days are over. You don't need to do that. Go get your bedside experience if that's what you want to do. If you want to be a nurse practitioner, you have to have bedside experience in order for you even to get into that school for the most part. Like there's certain things, there's certain criteria that you have to meet. That's just being honest, right? So, like I said, but what I don't like is all the other stupid shit that happens out, within nursing, like legitimately. So it says, do you think it matters if someone goes through a community college than a private school? It does not matter where you get your degree from, as long as they are an accredited institution through that state's board of nursing. Go to a community. You want to know why? Is because you're going to private school or community school or university. You're going to take the same NCLEX. If you're doing an ADN RN program or a BSN RN, same NCLEX. Doesn't matter. Haley says, I have a legit question. What is your legit question, Haley? Is it Kiona? Kiona, yeah. So it doesn't matter what school that you go to. I honestly would recommend going to a community college. It's just that the community colleges are so backed up and they're so hard to get into. Beautiful Soul says, what is your recommendation for a new grad LPN so you're graduating in December, or you graduated last December? So let me know. Shout out to all 63 y'all. Wait, which one? Which one? Beautiful soul. Which one? Got to elaborate for me. But shout out to all 63 of y'all in here. Appreciate y'all rocking with me. We're doing essentially Ask Me Anything in regards to nursing. We did NCLEX questions. Make sure you guys like, share, follow. Kind of funny sometimes, so whatever. Do you live in a state that pays well? A lot of people really complain in the state that they work in. So the highest state that'll pay you, honestly, is California. Specifically the Bay Area. However, that cost of living matches that salary. Some people are just like, hey, I make $110 an hour, so I make $200,000 a year, but they're paying $5,000, $6,000 a month for a 1-bedroom apartment. Balances out. So here's the thing. Working as a staff nurse, if you're looking for like the big check, not really, right? Now, if you're doing it as a traveler, and if you know how to navigate the traveling aspects, of being a traveler, then you can get money there. You can use your nursing license and do non-traditional jobs like, work for an insurance company, do biotech, pharmaceuticals, all kinds of different stuff. And you can make big money like that. Like one of my friends, that I worked with in the ICU, she went from the ICU making 50 grand a year. We both were, to her going to work at a hospice making 120 a year. And I'm like, what? You see what I'm saying? So it all just depends. It all just depends. Who said they passed the NCLEX? Miss B said, hey, shout out to you, girl, passing your NCLEX. Hey, look, hey, you know what you should do? You should just send me an email. Just send me an email telling me how great my lives helped you, because I'm going to put that comment on my website. So I'm going to need for you to do that for me. Shout out to you, Miss B. Everybody give Miss B her flowers right now for passing that NCLEX, right? Welcome to the greatest shit show that you'll ever be a part of. So you already know what the deal is. But hey, congratulations to you. I know that you're going to do great out there. But broke boy. But yeah, it all just depends on the state, bro. It really does. Yes, I just started this Tuesday. I'm having to take a college algebra and micro with lab right now, but online. Oh, okay. I got you. I was drinking 3 quarts of apple juice. What? I won't die right of intoxication in less than a few hours. Haley, what kind of question is that? I'm laughing because I'm trying to make sure I'm understanding you. How did you study? What? How did you Oh, she's asking you that. Okay, shout out to you. I can't even pass college algebra. Well, you better get that mathin'. It's ghetto, ain't it though? That test is ghetto. So, hey, but shout out to you, Miss B. Shout out to you. Hey, but hey, legitimately, hey, if you want to leave me a comment, I love it, because I legitimately will freaking Like you can go leave it on Instagram. You can go leave it on Instagram. You could leave it on, you could leave it wherever the hell you want to leave it. You could email it to me because I literally will put it up there, because that right there, that shows that this works. An ER nurse, that's what I'm talking. Now you're really about to get into this shit. That's what I'm talking about. I love that for you because I know that's where you're getting. I'm not joking. Water intoxication, isn't that a thing? Yes, it very much is a real thing. How much you said? Let me see how much you said you drank. I was drinking 3 quarts of apple juice. How fast did you drink the apple? Oh, you said in a matter of a few hours? In less than a few hours. You got diabetes or something? You got diabetes, Haley? This is probably a little bit too personal. You probably don't have to answer that. But I would definitely be watching, like, listen, thinking about that heart rate. Make sure you're not throwing up. Make sure, like, hey, like letting people know, like, to watch you if you have altered mental status changes. Definitely consult a physician at that point. I can't give medical advice because I'm not a doctor. You know what I'm saying? So I thought I wanted to be a CRNA, but I have clinicals in the CCU, and I feel like it's a lot going on. There is a lot going on in the critical care units, and trust and believe me, you need to have at least a year of experience in the ICU to even apply. But most of the time, it's anywhere between 2 and 3 years where like they'll pick you up for it. CRNA school is very, very expensive too, like $250,000 to like 300, or like $200,000 to $300,000, and it's a 3-year program. It's a doctorate. You're gonna work that ass off, best believe. But the greatest thing about being a nurse, and you even saying that, is that you have options. Like, you have a lot of options on where you can go. And don't let a motherfucker say that you don't got options, because you do. Trust me. But there are some things that you need. If you want to be a CRNA, you have to do critical care. There's no way around that. You have to do it. Do med surge, girl. What? Hold on, sorry. I graduate from the RN program in December, and I have no idea where I want to work. Advice. Here's my thought. If you don't know where you want to go to med surge, because at least that'll give you time to figure out where you want to go on your next portion of your RN journey. But while you're figuring that out, you are learning your time management and putting those skills to use, while making money, so on and so forth. So that's what I would recommend. If you don't know where you want to go to MedSurg. Do MedSurg, girl, if you don't know what to do. What? I'm assuming that's what you meant. MedSurg will give you a good, yes, exactly, 100%. Is it Liani? It says, do you have a schedule that you go live, or is it just random? I start LVN on Monday. I do lives every Monday, Wednesday, and Friday at 5:30. I'm going to put it up again on my bio, as well as make sure you guys hit the notification bell, for that way you get notified when I do go live. So at least you know, like, hey, he's up. And also, if you miss a live, I put them up on my YouTube. All of my links are in my bio. They'll take you to the link tree, and everything is in there. So you can check that out as well. I want mother-baby unit if I pass in 2 weeks. Any thoughts on that? Well, first of all, we're going to change our thought process, and we're not going to say if, but more when. It says, I'm going to mother-baby when I pass in 2 weeks. Any thoughts on that? And my thoughts would be that, cool, go there. Liani says, okay, thank you. You're welcome. You're welcome. All right, I'll answer a couple. I want to go to mother and baby. I'm a PCT there, so hopefully I will get to transfer. Says, same thing. And the thing about it, you're a PCT there, so you should already have pull. You should have a lot of pull already. So, all right, y'all. I'm going. That's what I'm talking about. All right, y'all. Hey, it's 8 o'clock. I'll answer one more question or whatever we got going on here. I really enjoyed this live. I will pass my NCLEX my next attempt. That's what I'm talking about. That's all I want to hear, is that I will pass it. You know what I'm responding to that? You damn right. You damn right you are. Alicia, I appreciate the follow. Yes, postpartum nurses, baby. Hey, shout out to y'all, because y'all are better than me. I can't work up there. I'm scared. It scares me. But hey, I'm going to shut off for the night. I hope everybody has a wonderful and safe weekend. Be kind to yourself. All right. Love yourself, because there's only one you. And if you can't take care of you, you can't take care of nobody else. Not your spouse, not your kids, not your terrible ass baby daddy or baby mama, whoever you with. All right. So be kind to yourself. All right. Takes nothing to be nice. But all right, I hope you guys have a great weekend. All right, and I will see everybody at 5:30 Central Standard Time on Monday. And we might just do psych stuff because somebody asked. So we'll make it a surprise, but we'll see. But bye.